Мы с вами живем в крайне непростое время. Переход стран на внутреннее финансирование, реформы здравоохранения, 267 миллионов новых случаев COVID-19, низкие темпы. Мы с вами живем в крайне непростое время. Переход стран на внутреннее финансирование, реформы здравоохранения, 267 миллионов новых случаев COVID-19, низкие темпы вакцинации и стремительный рост новых случаев ВИЧ в регионе Веца. Наша задача – предотвратить передачу ВИЧ и спасти жизни как минимум 1 миллиона 600 тысяч человек в странах Веца. Региональные лидеры взяли на себя инициативу. В наших с вами силах спасти миллионы жизней. Мы собрали более 150 экспертов из 21 страны, в числе которых министры здравоохранения, мэры и вице-мэры, представители международных, национальных, государственных и неправительственных организаций для безотлагательного диалога и решения реальных проблем. Приветствуем вас на форуме устойчивого здравоохранения ВИЧ и COVID-19 в регионе Веца.
I am so happy to welcome each of you, each of those who are here with us today. And of course, we applaud to those who are here in this audience today. Thank you for being on time, being the first ones to come. And let's give you a round of applause. And of course, let's also welcome all those who have joined online today. On that side of the screen, we have organized the broadcast. So they're using a variety of gadgets, and thank you so much for having joined us. I'm Vika Konstantinova. I'm going to be the facilitator for this event, and I am so happy to welcome you at the first Regional Health Sustainability Forum, HIV and COVID-19 in Eastern Europe and Central Asia. Here we expect loud applauses. And you know, dear friends, I would like to mention that under the current condition of the crisis in the context of COVID and HIV/AIDS, this forum becomes even more significant, because I believe that it is difficult to overestimate the impact of that, because this kind of events are key to overcome this kind of crisis that we are witnessing now. Here, as nowhere else, we can focus on the newest data, newest information, and of course the leading practical experience for development of counteracting HIV and COVID-19 epidemics. So I believe that here you will hear all of those who are at the forefront fighting some of the key problems of modern times, and all of that concentrated in the same place and at the same time. Issues of health are as relevant as they have never been. In the modern world that is fighting COVID-19 pandemic, these issues have become really especially significant. And these new global challenges, they request new response and new solutions. And of course, they require our collaboration under new terms and conditions, where all countries openly interact and share the experience. And of course, I believe that now absolutely everyone understands that. Because today, in this audience, we have the representatives of the geographic localities that prove that. And let me welcome me and the organizing team and you. Let's applaud to everyone who is here.
To come, and we would love to give a big round of applause to the geography that we're having here today. Итак, от Таджикистана до Швейцарии. Это Беларусь.
From Tajikistan to Switzerland, Belarus, Bosnia and Herzegovina, Georgia, Kazakhstan, Kyrgyzstan, Lithuania, Macedonia, Moldova, Netherlands, Poland, Montenegro, Romania, Russia, Serbia, Turkey, Ukraine, Uzbekistan, Czech Republic, and Estonia. Representatives of almost all countries in Eastern Europe and Central Asia and Eastern Southern Eastern Europe. All of you are here, and thank you so much for being here. So who are the participants of our forum? Actually, these are the people who have undertaken the responsibility and leadership fighting for health of residents of cities, countries, and even regions. These are the heroes who, on the day-to-day basis and with their activism, rescue millions of lives. And now I would like to ask you to applaud to those who make history, those who make the world better, healthier, and safer. Of course, let's welcome all health professionals, volunteers, civil society activists, human rights activists, lawyers, politicians, all those who are at the forefront of the fight. Our forum will address most important topics, and we will share the state-of-the-art achievements, developments in fighting HIV, AIDS, and of course COVID epidemics. We will try to summarize this struggle so far. We will share innovations, technologies, and of course, what's most important, we will share some examples, case studies on the path towards the world free of HIV and COVID. Let me explain the format. We are a bilingual conference, and during the sessions, the participants will speak both Russian and English. So for all participants of the forum, organizers have prepared headsets with simultaneous interpretation. Online broadcasting is also in 2 languages bilingual, so we really hope that we will definitely have any problems about interpretation today. And of course, every panel discussion, every topic of our forum is going to be the focus of knowledge and experience. And it is so important for us that this information we are perceived as extensively as possible. So we will take short breaks. We will tell you in advance about those breaks, and also we will present presentations by participants in thematic blocks. In this way, it will be possible to perceive all the information that we have prepared, our speakers have prepared, better, to digest it better. And before we start, for organizing of this wide-scale event, we are grateful to Public Health Alliance, SOS Project Consortium, and partners of the regional project from 14 countries. And thank you so much. I would also like to express gratitude to the information partner of the forum, the UN HIV/AIDS program, UNAIDS. And financial support for the forum is provided by Global Fund for HIV, TB, and malaria. So, dear friends, we are quickly moving towards the first panel discussion, and let me remind you that for more than 20 years now, Public Health Alliance has been one of the largest NGOs, not only in Ukraine but globally in EECA region. The organization provides support for more than 250,000 people representing key populations. And this indicator is the highest in Europe. And of course, to moderate this kind of events, conferences, fora, needs those people who are definitely experts and specialists in the area. And that is why all of our moderators, they are going to be experts, high-level experts and practitioners who have extensive experience. Now, to moderate the first panel discussion, Sustainability to Counteract HIV in EECA, Key Entry Points. I invite ambitious leader to fight against HIV and TB, innovator and true missionary of the cause, Executive Director, CEO of Public Health Alliance, Mr. Andrei Klepikov. And you're very much welcome, Andrei. You have this microphone there. Thank you so much. Dear friends, dear colleagues, I am so happy to welcome you all here in Istanbul. There are more than 150 participants in the audience, and that's so good to see you all and to say hello, to hug you. That's a great opportunity to exchange the achievements that we have accumulated during the several years while implementing the project. I also welcome all of those who have joined this event online, because the hybrid format, this is the reality of nowadays. So the Health Sustainability Forum. Currently, COVID-19 pandemic has transformed the world and has introduced some lack of sustainability, and that is why we decided to speak about sustainability today here. And we have all the grounds to do that, because when we work on HIV, we accumulate the experience and the solutions that not only make it possible to maintain these programs, but to modify under COVID situation and to roll out best practices in other healthcare sectors. And that is why the title of the forum is ambitious, a Health Sustainability Forum in EECA region. And now I would like to pass the floor to invite the panelists, participants of the panel discussion, to this scene. Thank you so much for your introduction. If I may, let us announce all the participants of the discussion. Peter Sands, Global Fund for AIDS, TB and Malaria. Alexander Galiusov, CEO of Regional Office of UNAIDS for EECA countries. Viktor Lashko, Minister of Health of Ukraine. Pavel Bem, member of the newly established Commission on the Drug Policy for Eastern Europe and Central Asia, and Marka Gogia, Georgian Harm Reduction Network.
So I would like to start with a question to Peter Sands, Executive Director of the Global Fund. So the Global Fund is the key donor for the programs in the area of HIV and tuberculosis in the EECA region. So my question: how does the Global Fund see the situation? So how programs on HIV and TB can be made even more sustainable?
Thank you, Andre, and my greetings to all the participants of this really important Eco-Sustainability Forum. Your question, how do we make HIV-TB responses in the region more sustainable, is a really important one. One thing we have to do is to make sure that the interventions that we are working with you to make, either through country grants or the multi-country program, aren't just about project-based interventions, but are designed to support the development of sustainable health and community systems, systems that can live and thrive and deliver for the people who need them, even after the Global Fund has withdrawn. Critical to making that happen is ownership by the communities, by the governments of the countries, and the commitment with that ownership to actually deliver on the promise of ending HIV and TB. Now, we can encourage and work with you to catalyze, but ultimately that ownership has to be taken on by the governments and communities themselves in the countries themselves. One critical aspect here is human rights. Today, obviously, December 10th is International Human Rights Day, and across ICA, human rights barriers continue to be a massive hindrance to the delivery, to providing access to effective HIV services. And we're not going to defeat HIV/AIDS unless key populations can get access to such services. So when I think about what we need to do to make HIV and TB programs, responses sustainable, I would say three things. One, systems, not project-based interventions. Two, establishing community and country ownership of the fight against HIV and TB. And three, tackling with determination the human rights-related barriers that hinder the people who are most affected from gaining access to those services.
Thank you, Peter. And really, I would like to underline some key aspects. That the investments of the Global Fund to community systems and health systems in general, they have to ensure sustainability. And I would like to thank Peter for reminding us that we have our forum on the Human Rights Day, because human rights are the basis for sustainability, because sustainability is about access to services for the most vulnerable and marginalized populations. And now I would like to give the floor to Alexander Galeusov, a regional director of UNAIDS. So could you please tell us which achievements do you see in the region in response to HIV, and what are the key areas of efforts to reach our goal of 95, 95, 95? Good morning, dear colleagues. On behalf of the United Nations AIDS Program, UNAIDS, I would like to welcome the participants and guests of our regional forum, which is called Health Sustainability Forum HIV and COVID-19 in the Eastern Europe and Central Asia countries. I would like to heartfully thank you for all your efforts in response to HIV, coronavirus, and other socially significant infectious diseases in the region as a whole and in separate countries. So during the recent years in HIV prevention and treatment, we have achieved a big progress. However, to end the epidemic of AIDS by 2030, we still have a lot to do. Today, we will discuss the most urgent questions of HIV treatment and prevention, to define the most effective ways and methods to overcome the existing problems. The main ones for the most countries of our region are not sufficient level of detection and low coverage of vulnerable populations with the services and discrimination in access to services, first of all for the members of key and vulnerable populations, including migrants. And I would like to underline that all our joint initiatives have to be aimed at improving the indicators of the cascade to bring it closer to 95 targets. This is the goal which was approved within the global strategy, also by the countries of our region, and those countries committed to achieving this goal in the next 5 years. And I would like to say a separate thank you to the mayors of the city and heads of municipalities, representatives of civil society and HIV service organizations who are present at this forum and who work and will continue working within the Paris Declaration to end AIDS in the big cities of the region. So out of over 200 cities who joined the declaration, 29 are in our region, and only in the recent months, 7 municipalities and cities in Serbia and 1 big city from Ukraine, Kryvyi Rog, joined this initiative. So with all my heart, I welcome the heads of municipalities and cities who made a decision to join the declaration. Welcome. Joining Paris Declaration will allow to give a new momentum to the municipal statistics, diagnostics, treatment and prevention of HIV in the cities. Also in the key populations, through giving access to the most up-to-date practices in this sphere. UNAIDS provides and will continue providing to the participants of the Paris Declaration priority support and help. So thank you for your attention and have a fruitful forum. Thank you. Thank you, and I would like to draw your attention to the words about the roles of the cities. Really, in ensuring sustainability, cities are a very important actor in the context of decentralization and in terms of access to most vulnerable populations who live in those cities. And now I would like to announce our next speaker, Minister of Health of Ukraine, Viktor Leshko. So Ukraine is a successful example in terms of transition of HIV programs to domestic funding, even within the context of the COVID pandemic. So how did you manage to do that? So, dear colleagues and foreign participants, at present moment, progress in AIDS response is at risk because of the ongoing 2-year crisis with COVID-19. The crisis disrupting the operation of HIV prevention and treatment services, education, violence prevention, and many other programs. In the course of our response to the AIDS pandemic, we learned a lot of things we need to fight, not only AIDS, but also any other pandemic. We urgently need adequate community-led and community-based infrastructure, strong and resilient healthcare systems, and high level of commitments from the civil society. Currently, even during the COVID-19 pandemic, Ukraine manages to maintain uninterrupted provision of the HIV prevention services. It happens thanks to the active cooperation of the government and the civil society. It is possible largely because transition of HIV services to domestic funding has taken place. I would like to point out that in Ukraine, the process of transition of HIV/AIDS services to domestic funding was not easy, but any problems arising were resolved through the dialogue between the government and the civil society. And this ability to hear each other allows Ukraine to achieve the results that we see today and that seemed impossible to many people in 2018. The result is the plan on transition from donor to state funding implemented in the country. This process was a real challenge for all parties involved, but we have succeeded. In particular, I'd like to tell you what steps Ukraine made to achieve this result. Firstly, government funding mechanisms were developed to provide public health services to vulnerable populations in the context of HIV. Activities were carried out to calculate the costs and develop the standards of service provision, with legislation revised to allow engaging non-government actors in service delivery. Secondly, an important tool to ensure the sustainability of HIV response was participation in the Fast Track Cities initiative in joining the Paris Declaration. This approach is currently implemented in Kiev, Dnipro, Odessa, Mariupol, and Kryvyi Rih. For instance, only in 2018-2020, Odessa allocated over 65 million hryvnias within its municipal program for HIV and tuberculosis response. Thirdly, optimization of the HIV medicines procurement allowed saving a lot of money and, as a result, opening opportunities to treat more people. In partnership with the World Health Organization, the Medicines Patent Pool, and civil society organizations, we boldly used the international mechanisms to bring down the prices for ARV drugs. Today, Ukraine scales up its experience to 13 countries in the region of Eastern Europe, Central Asia, and the Balkans. Within the regional project supported by the Global Fund, we are able to share both our mistakes and achievements and help others to go along this difficult path together with us. Ukraine calls all countries of the region to intensify their efforts to ensure sustainable government funding for HIV services and do it taking into account the Ukrainian experience, which proved to bring real results. Thank you for your attention and wish you a fruitful discussion. Thank you. And the experience of Ukraine is really important, and I am thankful to the Minister for presenting the key components of sustainability of the programs in Ukraine. But what is more important is not just what, but also how. And the guarantee of success was cooperation and interaction of the government and the civil society, which allowed to ensure the transition. And now I would like to invite
Marka Gogia and Pavel Bem to join me on the stage. Applause, please. So my first question is to Marka, but let me introduce Marka again. Marka Gogia, Program Director, Georgian Harm Reduction Network. So my question is, we talked a lot about funding, but sustainability is not the same as funding. So my question, what else do we need to ensure sustainability besides money?
Thanks for the very interesting question. First of all, greetings to all here, and I have quite unusual feeling sitting here as a first real speaker. Yes, we need a lot of, a part of money and funding from Global Fund and other international partners. That is experience. This is collaboration with multi-partners. That is close collaboration between government and civil society and individual activists also. This is implementation science and operational research. This is innovative program, especially peer-to-peer driven interventions to reach hidden population. This is experience of country experience, sharing of country experience, I mean. This is access to new model of antiretroviral treatment like long-acting antivirals, as well more efforts to be done to combination prevention, to innovative prevention and treatment programs. And we also need efforts to be done to develop special skills for advocacy among community members, to set proper targets and to realize them. We need a lot of issues to be developed. Thank you.
Thank you very much, Mark. Yeah, what I picked up, let's applaud. Yeah, what I picked up, it's really innovations, because you cannot be sustainable with old tools. Yeah, and community voices, because the real drivers are communities. So it's really, really important. And my next question is to Pavel. So let me introduce you firstly, Pavel Bem, member of the Global Drug Policy Commission and also a member of newly established Regional Drug Policy Commission in Eastern Europe and Central Asia, and former mayor of Prague. Applause, please. So my question is, we still keep hearing about human rights violations and stigmatization in our region. In your focus on the drug policy, how do you see the priorities? What things needed to be addressed here?
Доброе утро для всех. Спасибо большое за приглашение.
Good morning, everyone. I will speak in English, so please use headsets.
And I was also a mayor of Prague, involved for a long time in high-level politics. And I would like first to inform you about the last developments. Professor Kwaśniewski, Alexander Kwaśniewski, former president of Poland, and Michel Kazachkin, former executive director of the Global Fund to fight AIDS, TB, and malaria. And with me, we have founded the Eastern and Central European and Central Asian Commission on Drugs, which is a part or regional commission of the Global Commission on Drug Policy. The main reason for establishing this regional commission, members are Vytenis Andriukaitis, former European Commissioner for Health and Food Safety from Lithuania, Elvira Subardalaeva, former Deputy Minister Deputy Prime Minister on Social Affairs from Kyrgyzstan, Elena Pinchuk, founder of the Elena Pinchuk Foundation from Ukraine, Andris Piebalgs, former European Commissioner for Development. So, high level and very experienced former politician or experts. And the reason for establishing the regional commission was very simple. The region is home of 1/4 of people who inject drugs worldwide. Access to harm reduction and human rights-oriented services in this area remains very limited. Is one of 2 regions globally in the world where HIV incidence is still going up. Moreover, the criminalization of drugs and drug use is the main cause of high rates of incarceration, and this again affects the speed or HIV reality. And certainly, the region also face considerable problems associated with the illicit drug trafficking from Asia, actually, also from Latin America to Europe. And it's also affected by the latest developments in Afghanistan. So goals and objectives and recommendations forward are very simple. First, to advocate for and to develop and put forward evidence-based, high-level, honest dialogue with authoritative recommendations for drug policy reform. Second, to raise a public awareness and also political commitments throughout the region, engaging high-level strategic advocacy. I'm talking now about prime ministers, presidents, ministers of health and social welfare, certainly Minister of Interior and other person involved, and also certainly involving the public, media, and also civic society, to develop local and regional capacities to affect the drug problems. This is something which is a part of the key goal of this forum, how to make sustainable all the investments done in the region, specifically in the time of COVID-19, which for the first time probably in the history of the world put public health on the first perspective to politicians and to decision makers. On the other hand, we see all the financial constraints around not only the region but around the globe. We work within the sub-regional or regional commission in the spirit of being pragmatic, prioritizing health, human rights, dignity, safety. We are very much aware of the fact that there is a huge diversity in the region, and we see at least 4 or maybe 5 sub-regions with very specific, country-specific needs. We also see many common denominators, like, for example, the need to reform the criminal justice systems toward decriminalization. This is just an absolutely key prerequisite for long-term effects of good public health and human rights-oriented drug policies. We see also the opportunity to broadly introduce extremely cheap HR services, needless syringe programs, opioid agonist programs, I don't know, supervised injecting facilities, but also other strategies which are well known and evidence-based to prevent spread of HIV, TB, hepatitis C, etc. We also see the need to address the fact that access to controlled medicine, analgesics, opioids, all the substances which can help survive human beings in tough situation of serious illnesses, that we see that in the region the access to controlled medicine is limited by many administrative obstructions. We also see the need to address issue of trafficking and corruption, because all the region is very much influenced as a former post-Soviet region by the Russian policy. And I say that in many aspects which are affecting also our goals. So we have just come back from Bishkek, the capital of Kyrgyz Republic, with many promising challenges, and the Commission with President Kvasniewski and Michel Kazachkin and all other members involved are just looking forward to introduce the high-level strategic political debate in order to make sure that funds will be in place, because it's cost-benefit from long-term perspective, and that the right interventions will be also in place. This is just the best way how to reduce or even eliminate the unintended negative consequences which are associated with wrong, prohibition-oriented drug control policies. And if we look at evidence and if you look at the data, it's clear that especially our region needs to look at these objectives and goals. Thank you for your attention.
Thank you. Thank you very much, Pavel. And first of all, I would like also to congratulate all of us with the establishment of the Regional Drug Policy Commission. We need this. We need such a great policy player in the region. And what I picked up from your comment, really to focus on the health priority, put it as on the top of the list for politicians, for policymakers, and we cannot achieve health sustainability with violating human rights, with criminalizing dependent people, drug-dependent people, other key vulnerable populations. So it is critical to put emphasis on health, not on policing, not on repressive drug policy. So, thank you very much. Перехожу на русский. Спасибо.
Now I switch to Russian. And thank you so much, Maka. Thank you, Pavel. We invite you to take your seats in the audience. You're welcome. So we are summarizing the first session now. And here, actually, we have heard about key prospects for sustainability. We have heard the address from the key donor in the region from the Global Fund. We have heard the vision of representatives of the technical agency, in this case UNAIDS. We have heard the perspective from the public sector, from civil society, and from the politician and policymaker. That's a very important combination of perspectives. And moving on, we would like to continue. So when we analyze this past 3 years, we can see how many transformations have happened in the EECA region. Many of them are due to work of the SOS project. These are joint achievements that we have, all of us together, working within the consortium with all the counterparts in the countries. And I would also like to say a couple of words about that. But I would like to present it in a new format, not by standing here on the scene, but here I will need assistance from Vika, from the moderator. Andrei, I'm waiting for you here in this audience, and while Andrei is coming to join me, let me explain what's going to happen. So the forum is ongoing, and we will continue speaking about important questions. And we continue focusing on the situation of HIV/AIDS in Eastern Europe and Central Asia. But now we will try to uncover this topic in a little bit different way, through the prism of not speaking, lecturing, monologue, but as a live interview in front of the audience of several thousand people. So Andrei Klepikov, this is the person who for many years has been leading the International Charitable Foundation Public Health Alliance, working at the forefront of fighting hazardous epidemics of HIV, AIDS, TB, hepatitis, and COVID-19 with the group of like-minded people, and together with the other activists fighting to put an end to these epidemics, and of course to rescue millions of lives. So he will tell us about the progress and the result that it has been possible to achieve, and somehow I guess, well, Andrei is here already. Hello, this is our improvised studio, and now they are going to put the microphone on you, and after this short introduction we continue. Our forum is focused on summarizing of huge work that has been undertaken by thousands of people during many years. And today we are going to speak about sustainability of HIV programs, and this is the question that I would like to address to you, Andrei. sustainability of HIV programs. To put it simply, what is that? What does that mean? Well, it would be easier to say that HIV programs continue working after international financing funding is stopped. This is the reality of our region, of EECA region. International donors are stepping out gradually from the region. And the key objective is to ensure that the programs continue sustainably. What we need for that sake? We need several approaches. First, it is smart spendings. And this is key because huge amounts are overspent from from public budgets. Second, this is that funding needs to go in line with the needs, where there are the highest levels of needs, where there is the highest risk of infectioning. Then systemic approach. This is critically important, that innovations, funding from local budgets, from the national budget could not be reversed. We need to launch the mechanism that would only progress. And most importantly, I believe it is the fundamental value of human rights and being patient, client-focused, being led by their needs. And as public financing, public funding needs to be streamlined to NGOs that are the closest to those people with that encounter highest risks. In the framework of the project, we have managed to discover an answer to a very important question. You're smiling. Well, yes, where should we take the money if there is no money? That's a good question. We have found an answer to that question, and that amounts to the huge 119 million US dollars. 119 million, but that's huge. That's huge budget. So how did you manage to find that? And especially, again, you mentioned that there is no money, so where to get this 119 million? Let me first explain what figure that is. Before we started the project, we have calculated how much money is invested into treatment of HIV-positive people according to international standards. So at least 90% of all people infected, they need to have treatment. So the amount, the benchmark amount that we took into as the basic amount, and for the 3 years we've been working to reduce the cost of ART treatment, and by the end of the project we've conducted the calculation, and we could see that absolutely the same number of people with the same quality drugs could be treated, but with the budget that is $119 million less. And that's huge amount. We could mention that it is equal to 2.5 million replacement therapy, substitution therapy treatment courses for people using drugs, or in the Russian Federation, where there is undercoverage, the greatest undercoverage with treatment, so additional 170,000 people more could be treated in the Russian Federation. And we could go on and on. And actually, if we speak about different countries, maybe there is a more specific example, a case study. Well, yes. I could mention some examples, but the mechanic approach is this. This is price monitoring, optimization of treatment, courses, advocacy work, working with pharmaceutical companies, and also generics entering the market, and so on. And we see convincing examples. Tajikistan, for example, over the 3 years cut down the price for the same drug by 2 times, from $208 to $91. And the result is not just the figure. Success is about human lives. So actually, what we have managed to achieve is that 2 times more people now have access to treatment in Kyrgyzstan due to this optimization. And that's an incredible result. Almost the same reduction we witness in Moldova. And that's also due to international procurement. And we could continue, we could go on and on. That's a positive result. Now, speaking about results, HIV programs in which countries of the regions were most sustainable, if we could address that? Could you mention some cases? I would mention the case of Ukraine here, because we have managed to achieve allocation of budget for prevention among most vulnerable groups. These are injection drug users, sex workers, MSM populations. Until recently, funding from the state budget was zero from the state budget for these programs. However, it was possible to not only have some funding, but also to allocate that as a dedicated budget item, budget line. That's now transparent. You cannot now hide this money somewhere in some common pool where it is difficult to understand where the money goes. And the case of Ukraine, monetary speaking, it is $7 million annually for prevention programs for key populations. For Belarus, it is 12 million, which are aimed at the care and support programs. For the first time, they have launched a public contract where they finance NGOs in that way. Kazakhstan, that's 4 million. Georgia, 3 million allocated for programs for injection drug users. And also there are countries where success is measured not only as an amount of money, but in dynamic figures. For example, recently we hear from North Macedonia, where even though there are all of these COVID-related difficulties and all of that context, there it was possible for the next year, for 2022, to allocate the budget that is 42% higher than the current budget, the budget this year. And that's huge, a huge step forward. So that's cool. Again, in some other aspect, but again, this is 2 times increase. So you mentioned involving cities into the project. Can you tell us more about how and why you do that? Cities is a very important component to respond to HIV epidemics, because in cities, usually the epidemics is concentrated, is focused, and also due to decentralization, they have higher more extensive budgets. It's important for us to link these two facts in order that city councils allocated money for HIV response. And we managed to do that. We engaged 30 cities into the project from Skopje to Krasnoyarsk. Any success stories? Yes, of course. So some time ago, both Kyiv and Odessa became initiators, and they joined the Paris Declaration, or the Declaration of Fast-Track Cities. This is how cities could move faster to responding to HIV epidemic. So more and more cities have been joining this movement, and now we already speak about certain outcomes that all in all, by 1/3, it was possible to increase detection rate for HIV in cities due to additional resources.
And by 68%, we increased the number of people started on ART as compared to the start of the project. That is a huge step forward. And if we talk about 12 focus cities, we are talking about 65,000 of new patients who started receiving life-saving antiretroviral treatment. And this list can be continued. So if we speak about specific examples, we can take Chisinau, and this city went step by step. So the mayor signed the Paris Declaration, and then the city program on HIV response was approved, and then the budget was allocated within the municipal from the municipal budget. So in Kyrgyzstan also we have the city of Osh. From zero now we see quite a good funding of HIV program. And there is an interesting case, Chelyabinsk in the Russian Federation. There is a challenging situation in terms of funding for key populations. But cities became the leaders of change, and they started innovations in low threshold services. For example, people come to get a syringe and they are asked to show their passport, they need to prove their registration address, etc. So that's bureaucracy, that is about the barriers. Or when people come with the sepsis to health facilities and there's a long queue of people there. And what is low threshold services? That is when you have kind of green corridor. So if a person who has HIV can go directly to the doctor with the help of social worker and can start the therapy like tomorrow. And that is an important pathway, or this green corridor, which opens opportunities for both prevention and treatment. Because again, in the many cities of the Russian Federation, the harm reduction programs, they just do not operate. Nobody funds them, such programs. But in Chelyabinsk and in a number of other cities of this region, such harm reduction programs, they operate with the help of social workers and even special vending machines, which in the time of pandemic help people access protection means. And maybe there were also some innovations. Yes, of course. We started new programs in the countries, taking into account the knowledge exchange starting from the cities, because it is difficult at the national level to have big change. But cities, they were the agents and the leaders of change. And often such innovations were launched through operation research. What is that? That is just not only a new intervention, but at the same time also a research study to get the evidence to show that certain program works and brings results. As an example, we can speak about pre-exposure prophylaxis programs, which allow to reduce HIV transmission with risk contacts. So they were started in Moldova, Belarus, and North Macedonia through the efforts of the project. Also, we can mention self-testing programs in Georgia, in particular, which allowed people not to go to health facilities when there is often high threshold services, but just for people to run the tests through saliva. And the same happened in Kazakhstan. And also we can talk about programs for highest risk groups such as transgender people in Georgia and Kyrgyzstan. There was an operation study and a package of services was developed which responds to the needs of transgender people. So those are the services which include consultations of endocrinologists and, in general, a package of services allowing to address the needs of people in a transition. And it is very important because this is the most vulnerable population in terms of HIV. You know, now I have a question about human rights, because when we talk about different populations, because you have mentioned already this aspect, so the UNAIDS program says that violation of a human right is the key barrier in access to services. So how can we understand it? And have you worked on this component within your program? Yes, it is really an important component, and in fact, there are two fundamental approaches: public health approach and repressive approach. And it is difficult to combine them. You cannot give a condom with one hand and then abuse a person with another hand. You cannot give a pill and at the same time beat the person. So some method should prevail. So our main message is how to change the approaches and make a focus on the services which help to overcome the barriers related to abuse and violation of human rights. For this purpose, we launched the REACT system. So it's not just about monitoring of human rights violation, but also it's about response. How is it done? It is done with the help of paralegals or lawyers and peer support. So it stipulates working with people whose rights are violated and people around them. So in some cases, it can be just individual support, like to talk to the husband, to neighbors, to someone else around, depending on the perpetrator of discrimination, stigma, or rights violations. In some cases, it's about systematic solutions, like in Moldova, where based on the results of REACT implementation, legislative framework was changed, and now people with HIV, they can be foster parents and they can adopt children, and it is a very important achievement. And in some cases, we are talking about the violations at the level of lower medical personnel, like discriminating people with HIV who were not allowed to use public bathrooms, for example. So those are really important things which we changed using different approaches. In general, we are talking about over 6,000 cases which were documented and addressed. Unfortunately, in over 70% of cases, violations come from the government agencies. Here, I mean like health facilities, when people are denied medical services, and even more problematic are violations from the side of police. And it is not a secret that risk groups, they are also vulnerable in terms of interactions with police, such as people who use drugs, sex workers. Sometimes they are forced to pay bribes, they can be arrested, they can be even raped, because those people do not have access to mechanisms to protect their rights. And thanks to this project, we give them this mechanism. And there is another interesting aspect. It is related to the Commission on Drug Policy. So there is a global Commission on Drug Policy, and within the project we supported the creation of a regional Commission on Drug Policy. And the need is really great, because in this sphere there are a lot of rights violations. And just recently this commission was formed in our region of Eastern Europe and Central Asia. So it includes Alexander Kvasniewski, ex-president of Poland. He is the chair of commission. Also Michel Kazachkin, Elena Pinchuk, Vytenis Andriukaitis, Andris Piepalts, Elvira Surabaldieva, and Pavel Bem. And I want to, as a conclusion, to say that we carried out a research study together with The Economist. They are the world leader, and they have like an analytical center. So together with them, we made a calculation, like to calculate the cost of repressive drug policy. It's very interesting. Yes. So if we can rephrase it, so if we change at least in some way this repressive drug policy, so that people who use injecting drugs just on their own, not selling drugs, not being drug dealers, but who are just drug dependent, like to prevent these people from being arrested and put behind the bars. There's about 25% of them. That can lead to great savings of the budget. And this study of The Economist was a shock for the countries of our region, especially for the Russian Federation. You will not believe, but the amounts there are huge. We are talking about 11.5 billion euro. in 20 years, which can be saved and which can be used to implement health programs. That is a huge sum of money, and now we have food for thought for the countries, now that they know that they face a dilemma to invest this 11.5 billion euro in repressive systems, in the prisons, or invest them in health systems, in people and in future. It sounds very positive and perspective. Unfortunately, we are running out of time, and it was very pleasant to have a conversation with you. And I just have a final question, because we cannot not talk about it, because COVID-19 is about all of us. So did it influence you and your project? Yes, of course, it had an impact on us. It had a negative impact. So it had an impact on everybody, and our region is not an exception. And we see that Ukraine and Russia, unfortunately, are still leaders in terms of new cases of COVID and mortality in the recent months. And we see that in the Balkan countries, which are not so big in terms of population, but the pandemic was also a huge issue for them, but also it kind of mobilized us, because those developments that we had in the HIV programs, we were able to modernize them and use them in the context of COVID. First of all, to address the needs that we had during the lockdown, starting from the last year, such as the delivery of medicines and online orders of medicines to ensure uninterrupted treatment. Also, transfer of patients who earlier used to come to health facilities or to get the medicines every day, like now to use take-home doses, also using vending machines to get some supplies without face-to-face contact, and also addressing some new needs which arise, such as the problem of domestic violence, because sometimes in the context of lockdown, for example, women who use drugs, they had to stay inside their homes with their abusers. So we supported shelters in 6 countries, which provided support and legal aid to those women suffering from the COVID pandemic. And sometimes we are talking about technologies such as telemedicine, like for the patients to contact doctors, like as we had in Ukraine, or to doctor, as we had in Bosnia and Herzegovina, because COVID was a new thing for all people. Somebody was better prepared and somebody was less prepared. So it was important to have this knowledge exchange between doctors as well. It also was important to deliver rapid tests. So those are antigen tests which we delivered to 8 countries. And in some of them, the results were really shocking. In Ukraine, in Odessa, with rapid tests, project clients were tested, and those clients were from risk groups, like not all of them, but some people with the symptoms. And 75% of those tests came back positive. So 75, not 1%, not 5%, as sometimes we hear. It's not even 50% rate. So it shows the real picture when people with the virus, maybe even asymptomatic, they do not go to health facilities, and they would never especially go to get tested. But thanks to those rapid tests, which give the results in 15 minutes, it became possible to detect COVID cases in this vulnerable populations, and sometimes even provide treatment and save people's lives. 75% is really a lot, yeah, and that is what we had in Ukraine. In some countries, of course, the numbers were lower, but still they were high, like about 11%, like in Moldova, that's what we saw. But anyway, this intervention was really timely because tests which are free of charge, they are distributed through the health system. And homeless people, people who use drugs, sex workers, they would probably not get those free tests from health institutions. So those low threshold programs and our achievements in HIV, we use them in the context of COVID. Andrei, thanks a lot for our conversation and for your speech today. And thank you for explaining those important things with simple words. Thank you. And I would like to say that this is a joint work, not only by Alliance, but also all the partners in all 14 countries involved in the project. And that is a big work of the members of consortium, such as 100% Network and Central Asian Association of People Living with HIV, and the Eurasian coalition on the key populations health. So it is the result of our joint work. Thanks a lot to you and your partners. And now we have a little break, and at 11:30 we come back to our forum.
Дорогие друзья, объявляется 15-минутный перерыв. Ждем вас в 11:30.
So, dear friends, we continue our forum, and our next panel discussion is the best practices in municipal responses to HIV and COVID-19 epidemics. So here and now we will talk about the achievements and progress in the municipal response in the EACA countries in the context of COVID-19. Also, we will talk about the interventions which proved to be effective and what are the results, and of course, what we can expect in the future. It is really nice to realize that today new leaders are taking a commitment for HIV responses. Those are mayors of the cities and municipal teams from the cities. And it is very important because by 2050, 68% of population will live in cities. It is even nicer to see so many people from municipal authorities today with us, people who work to overcome problems, who are not afraid to take unpopular decisions and take the responsibility for the healthy future of their citizens in their cities and in their countries. So the topic of our next panel discussion is best practices in municipal responses to HIV and COVID-19 epidemics. So I would like to invite now our moderators and experts. So with your applause, Sergei Filipovich, Alliance for Public Health, and a program advisor of UNAIDS, Natalia Salabai. And I have a pleasure to introduce our panelists, Bertrand Autan, Vice President Strategic Partnerships, IAPAC France, Alec for Grafenried, Mayor of Bern, Switzerland, Gennady Trukhanov, Mayor of Odessa, Ukraine, Irina Kutsenko, Deputy of the Odessa City Council, Ukraine, Fadei Nagachevsky, Deputy Mayor of Chisinau, Moldova, Anna Starostenko, Deputy Mayor of Kiev, Ukraine, Venera Raskulova, Deputy Mayor of Osh, Kyrgyzstan, Nikola Ribaric, Head of Local Administration, City of Kragujevac, Serbia, Ivan Vukovic, Mayor of Podgorica, Montenegro, and Önder Yüksel, Rigid, Istanbul Metropolitan Municipality Head of Health Department. So, we are all here. We can start. Good morning, dear participants of the forum, dear panelists. So today we already heard the topics of the cities in several speeches. So cities where epidemics are concentrated, but also where resources are concentrated. And I would like to also say that cities and city responses are dynamic, and also cities are the innovation solutions are concentrated. So when we are talking about the experience of city responses, we are talking here about the sustainability of HIV responses. So over 4 years, Alliance has been working on Fast Track Cities initiative with municipalities and mayors of the cities, and within the SOS project since 2019 with 30 cities of the ECA region and in the Balkan countries. So we have countries signing a Paris Declaration and Zero to Be declaration, and we heard what brings together the fast track cities, that in those cities there are task forces which develop effective programs at the municipal level and also which advocate for improving the cascade of HIV services. In general, programs were approved at the city level and budget allocations were ensured at the municipal level. And also we heard the examples about Chelyabinsk and the initiatives implemented there. So fast-track cities, it's not about just money and programs, but also the initiatives which can be implemented in cities and then scaled up to the countries. Also, I wanted to say about the initiatives in Minsk, Soligorsk, Svetlogorsk, which also supported fast-track cities initiatives. In Soligorsk, the consultation office was opened for MSM and sex workers in Minsk. For the first time, projects for MSM and people who use drugs were supported. So it all happened for the first time. And in Svetlogorsk, there is a mobile a team working with people who use drugs. Also, municipalities of Chisinau and Osh for the first time allocated money to work with the key populations at the municipal level. And during the COVID situation, NGOs from Osh, together with the municipalities, ensured the delivery of medicines for those who receive treatment, as well as food packages. And these initiatives can be listed further, but it is important that those initiatives at the level of cities, they are aimed at improving access to testing and treatment in fast-track cities. Thank you, Sergei. Those achievements are quite impressive in our region. And on behalf of UNAIDS, I would like to remind our audience what is fast track, what is Paris Declaration. And I want to say about the importance of all of us getting engaged in this process. For this purpose, we need to go back to 2015, when the global community, under the aegis of the UN, approved the Sustainable Development Goals. And one of the goals, as we know, this is goal number 3, is overcoming the challenges in health and ending the most dangerous infections. One of such infections is HIV. In 2016, there was a declaration to and TB and HIV was approved, which is called Fast Track Initiative, and it became a global challenge and a global focus for many, many years ahead. So this year, this focus was reaffirmed with a new global declaration on HIV/AIDS, approved by the General Assembly of the UN by the majority of countries. The strategy stipulates a number of program actions, but the essence of it is the 1990 cascade targets, which now transformed into the targets 95, 95, 95 till 2025. It will help us all to come back on track to fight the infections so that we can have 0 diseases and 0 deaths from AIDS. And of course, why are we talking about cities, about Paris Declaration? Cities are the places where 2/3 of people living with HIV live. That's a lot of people, and that is also a big opportunity. So the mayor of Paris, Anatalga, initiated the movement of the mayors of cities who will initiate the fast-track response now. This movement is scaling up, and we all heard that there are more than 350 cities joining the declaration, and we have dozens of cities in our region which joined the declaration. Why is our region so important? Because unfortunately our region is the region of the world where we have a growing number of new HIV cases. In many regions of the world we see positive dynamics. In our region it is not so positive now, and unfortunately only 53% of people living with HIV have access to treatment. And for all of us, It gives us understanding of what we need to achieve, because we still have a long way to go till we get 95%. And of course, seeing all the representatives of municipal authorities here on stage and all of you here in our room, I want to say that we welcome you all. We thank you for your participation, and of course we hope for knowledge exchange and sharing best practices in the cities. Thank you. And now I would like to give the floor to one of the initiators of the fast track. This is the IPAC organization, which together with the UNAIDS and UN Habitat and the Mayor's Office of Paris was one of the initiators of the Paris Declaration. So I would like to give the floor to Bertrand Audouin, Vice President on Strategic Partnership of IPAC.
Good morning, I'm Bertrand Audouin. I'm the Vice President of IAPAC, in charge of strategic partnerships and coordinating our activities in Europe. I am very happy that IAPAC got invited to speak today at this very important meeting, and I would like to thank the organizers for inviting us. And I would also like to acknowledge all the mayors, deputy mayors, and mayors' offices taking part in that very important meeting today. As you know, IAPAC is one of the co-founders of the Fast Track Cities initiative back on World AIDS Day, December 1st, 2014, together with UNAIDS, UN Habitat, and the city of Paris. At the time, 26 cities committed to reaching the 95-95-95 UNAIDS and WHO goals, but also to connecting programs on HIV, HCV, and TB, and fighting stigma and discrimination. Today, there are more than 380 member cities and territories in the world, about 86 in Europe, and over 30 in Eastern Europe and Central Asia. So this is a developing program for a good reason, or rather two good reasons. The first one is that it's a unique opportunity for local administrations and local elected officials to show, network, and showcase what they are able to do at the local level and have access not only to national platforms, but also to international platforms, as is happening today. And the second reason is that historically, local administrations, cities, and territories have always played a central role in addressing HIV, HCV, and TB, and developing new and innovative programs. And of course, the past 2 years with the COVID-19 crisis have shown even more acutely the unique role that cities and territories can play in developing public health programs. That's what the Fast Track Cities initiative is about. We have two geographical priorities at the moment. One is Western Africa, the other is Eastern Europe and Central Asia. And again, for two reasons. One is that Eastern Europe and Central Asia is one of the regions in the world where the HIV, HCV, and TB epidemics are still growing and developing. And the other is that there are many, many initiatives, many groups, many associations, many clinicians, many public health administrations involved in fighting HIV and HCV in that region, and that they deserve being brought together at the local level, at the city level, but also with our support at the national and international level. So for these two groups of reasons, we believe that focusing our efforts on the Fast Track Cities initiative on Eastern Europe and Central Asia has a lot of impact and will be very meaningful. And we hope that this meeting will also help you proving so, and hopefully reaching out to us after the meeting to discuss how your city can be part of the network, or if it is part of the network already, how we can make sure that we showcase your success and your challenges even better than we have done so far. So we wish you a very fruitful and very efficient meeting today, and we trust that we'll be in touch very soon. Thank you very much.
And to continue with what has been mentioned by Mr. Bertrand, about that we now link the program to counteract hazardous infections, HIV, TB, in this challenging time of COVID. Now we would like to pass the floor to everyone who have the best practices in the region. And let me explain how we are going to proceed. Most representatives of municipalities are with us here in the audience, and we will also have here representatives online, those who agreed to answer our questions and share their developments and achievements in the cities. Today, we have online the mayor of Bern, Alec von Grafendrief. This is one of the first cities that joined the Paris Declaration, the movement. This is the city where the epidemic is very similar to the epidemic pattern in most cities in the region. That was the epidemic that was led by people using drugs. And now this city has achieved the indicator of 0 new cases. This is due to the programs, to the progressive drug policy that has been implemented in that city. So now we ask Mr. the Mayor, what other programs would you recommend to implement in EECA region where HIV problem is still very relevant, especially among users, injective drug users?
Good morning, ladies and gentlemen. My name is Alec von Grafendrief. I'm the mayor of the city of Bern. I wish you a warm good morning here from the city of Bern to Istanbul. I'm very sorry that I can't be with you at this very moment. I would have liked to travel to Istanbul once again. I would like to share with you the experiences that we made in the city of Bern. You have to know that in Switzerland in general, in the big cities, Zurich, Bern, Basel, we had huge problems in the 80s and in the 90s with open drug scenes. We had huge problems in public spaces with very high HIV and AIDS rates. We had many deaths were laying in the streets. It was horrible. They were going to public bathrooms. They were going to hidden spaces. It was a misery. We had a huge problem. At the time, we basically had repression. We had repressive drug policy. And with that, we marginalized the drug addicts. They were going to chronic drug addiction, and it was social misery, complete disintegration of those populations. We had to agree at that very moment, we will come no further with the policy we had until then. All our politics with addiction treatment, drug deprivation, rehab, we didn't arrive nowhere. We sent them to prison, they came out, and they were suddenly back into an open drug scene with drug addicts. It was terrible. So in 1986, we had an earthquake because we had a complete change of our politics. We had an NGO contact ban, and that the NGO contact had a new idea. And the new idea was they opened a drug consumption room, a public drug consumption room which was a complete new idea. And it was the first offer of harm reduction in Switzerland and in the city of Bern. In the drug consumption room, they would have given them methadone, they would have given them all instruments for drug consumption, like hygiene, social care, medical care. So they had all kinds of care in that drug consumption room. In the following years, we even went farther. We had methadone from the state, and we even went so far to give them heroin by the state. So the city of Bern buys heroin and gives it to the consumers, and the consumers will get their heroin from the state. So they don't have to buy it in illegal markets. It's a complete change. So everybody has to change. The police has to change, because the police has to agree to let them quiet consume their drugs in the drug consumption room, which was very, very difficult for our policemen and our police officers to agree. Oh no, we don't touch them. It was very difficult also for all therapists, because they had to agree. We failed. We couldn't bring them therapy, and they had to agree. We won't take them away from drug consumption, but we accept that they will continue to consume drugs. So everybody, therapists, social workers, police, had to agree. Drug consumption is a fact. We let them consume, but we try to help them. And this was like the basic and the first step into a complete harm reduction project. And harm reduction was good for the consumers at the time, but it was also good because it eliminated the illegal drug market. And it eliminated new young generations to enter into the problem. So we have basically no new young drug heroin consumers, which reduced the amount of heroin consumers very much, which was a big success. Today, we still have, and this is 30 years later, we still have heroin consumers, but the heroin consumers are still the same consumers that we had 30 years back. So they get older and older, and today they are around 55, 65 to 70, up to 70 years, and we have to think to bring them into homes for elderly people, and they still consume at the age of 60, at the age of 70, they still consume heroin. But we have no younger generations getting into the problem. So the politics was a big success. It was a big success for our public spaces. It was a big success to reduce our HIV rate. And basically, we could fight our big HIV problem we had by the open heroin scene in the 90s and in the 80s. So it was a big success, and I can only give you the advice if you want to know more about it. We are very open to show and to share our positive experiences in that way that we made in the past years in Bern. I thank you very much. I wish you a very good conference. I hope to see you very soon in Istanbul, in Bern, or anywhere in your cities. And I hope that on a following meeting, I can come and to share positive experiences in other cities as well. All the best, have a good day, and then Merry Christmas. Goodbye.
Thank you, Mr. von Grafenfeld, for this information. This is very interesting, very important, and thank you for this very positive message and congratulations on the upcoming holidays. So to summarize what Bern has done, we could say that probably what our lessons could be here. As Andrei Klepikov mentioned when opening the conference, this is about low threshold programs. These are the programs that meet needs of people using drugs or positive people. And this is respect for human rights, above all the right to health. These are the programs that are based on very good knowledge of what's going on in this particular city with this particular population in this period of time, and some forecast for further development of the epidemic. And also, I notice that it is important to link our programs, public health programs, with social programs, because this is what makes sure that people have access to housing, some future, and welfare or decent aging of people with HIV infection or drug use related problems. So thank you, Mr. Grafenried. And following recommendation of the two previous speakers, we are moving to EECA region. We mentioned that in that region we still see further growth of prevalence of HIV, and at the same time this is the region where we see there are problems, barriers on the path of access to services, preventive services, ART, for those who need that. And my first question in this context goes to the Vice Mayor of Chisinau, so Mr. Nachevsky. After signing the Paris Declaration, Chisinau municipality has adopted 2 municipal programs already, and for the first time, money has been allocated to work with key populations. And also representatives of the mayor's office, municipality of Chisinau visited Bern, and what has been shared by Mr. Alec, you could see that with your own eyes, you could see those programs, that was exchange of experience, study visit. We also hear that you are planning to develop integrated centers for key populations for medical and social assistance and extensive access to testing. What else is the city planning to implement to achieve the 95-95-95 objective? What are the initiatives? Hello, and thank you very much for this question. Of course, for us, it is very important to bring the services closer to the patients. And one of the most important elements that we have been thinking about, this is about setting one-stop shop approach. Due to that, people who suffer these issues, they could have received services, healthcare services on the one-stop shop basis, not to run all over the city to have access to those services. We will also try to work with central authorities in order to humanize even further our national legislation, because we do have problems at the national level. We do have some repressive legislative provisions, and based on the new concepts of humanizing the provisions and fundamental rights, we need to update, to revise them. Last year, by the way, with the support of the Council of Europe and Pompidou Group, we managed to include into the national legislative framework the concept of therapeutic community for people using drugs and those incarcerated, those in jail. So we have a lot of work but due to the fact that the municipality, the mayor in Chisinau are very open to revolutionary change, and I believe that we will manage, we will include and implement a lot of new concepts in order to easier integrate these categories of people, these populations in the general society of the Republic of Moldova. Thank you so much. Well, this one-stop shop theory is nothing new, but it is quite difficult to implement. And this is due to the concept of low threshold access, because integration of services in one place, it is quite difficult to implement that in practice. And this is also linked with decentralization of services. And it is so good that you are moving in that direction, because that's true that one of the barriers is the fragmented services for key populations, where it is difficult to have this support for infections, for drug use, for example, for some preventive services. It's difficult to have access to that in large cities where you need to go to different places to get those services. The geography of our overview is moving eastward, and we ask this question now to Hanna Starastenko, Vice Mayor of Kyiv. So the city of Kyiv signed Paris Declaration, and it was the first Ukrainian city. You did that in 2016. In December 2019, the mayor of Kyiv, together with the alliance, met mayors of 20 cities in Kyiv, where you undertook new commitments and signed new declarations. And back then, Kyiv signed the declaration to join the initiative to combat TB. So we would like to ask you to share whether you are satisfied with the changes, transformations achieved within Fast Track. How did the situation of prevention and treatment change since you signed the Paris Declaration? You're welcome. Good morning to all of you, and I pass regards from the city of Kyiv, from the mayor of Kyiv, Vitaly Klitschko. So best regards for all participants of the conference, and thank you for addressing this very important topic. Even though today all of us are struggling with this COVID pandemic, we should not forget about other epidemics that for many years now have been a challenge for our cities, for the countries, and globally. So we are very grateful to the organizers, because no matter what, this is a top, it is high on the agenda of international community, this discussion, and also among international organizations. Thank you for asking this question. That's true that for Kyiv, health, human health is the key priority, and that is why our team has been working in order, to the extent possible, to bring healthcare services and closer to people, and also to focus on prevention and to cover absolutely all categories, populations, especially for key populations. And that's true that in 2016, Kyiv was one of the first cities in Eastern Europe to join the Paris Declaration. And back then, we developed the first municipal targeted program to counteract, to fight HIV/AIDS. And back then, the state did not yet allocate money for that, but Kyiv at the city level already provided funding for prevention, for treatment of HIV/AIDS in the capital of Ukraine. And here it is important for us to emphasize that we work in close collaboration with donor organizations that initiated these processes, and now we work directly with the government that is actively involved. And today we heard the address from the Minister of Health, and only due to the synergy when we work with the civil society sector at the municipal and national level, we can achieve results.
So you asked me if I'm happy with the results, but we are always critical about the results that we get. So there are certain criteria, there are quantitative indicators that we strive for, and of course we try to achieve them despite all facts. And I would like to I go back and see that we have a pandemic now, and at the times of COVID, we tried to adjust all our programs as much as we could to not to lose the positive results that we got through signing Paris Declaration and approving our municipal program on HIV/AIDS. So what did we achieve? Today we are focused on the prevention component in HIV response, and we have mobile teams, mobile clinics. Also, we actively work to provide pre-exposure prophylaxis. We use telemedicine, online and telephone counseling. And today, substitution treatment can be received by post. Also, we distribute medicines through the pharmacies in the city of Kyiv. So we try as much as we can all prevention and treatment activities to do them online or remotely, not to lose the achievements that we were able to make. And all the municipal health facilities are currently engaged in HIV treatment and prevention, and that is also important. So we tried to decentralize the provision of care. So our family doctors are now actively engaged in this work, and we see that despite COVID, in the recent 2 years, we see a growing number of testing and tests done, and with that we have a lower number of people who get positive results of the HIV test, and that is also a good trend. Today, Kyiv procures OST drugs more than within the national program, so we do more at the municipal level. So if we talk about more like from the qualitative to quantitative indicator. So for the first indicator, we have almost 78% of people covered. I mean, so and the dynamics is almost 6% in the last 2 years, and among all those people diagnosed with HIV, 84% of them receive ART, and that is almost 3% more than we had before. And the third indicator that we are almost coming closer to the target indicator, almost 95% of people who receive antiretroviral therapy, they have viral suppression. So in the last 2 years, this indicator grew by 5%. And as a result, today in Kyiv, we have 3 times decrease of HIV cases to twice as a lower number of AIDS cases, and also the mortality is 2 times lower, as well as the level of infections in pregnant women. And I think that those indicators actually speak for themselves. We see our weaknesses, and that is why today we have a big delegation from Kyiv City Council, and from our health facilities engaged in this work aimed at HIV prevention and treatment to learn about the best practices implemented by our colleagues and partners from other cities and countries, so that we can improve our indicators and move forward. Thank you, Ms. Starostenko. It is really good to see how separate activities and interventions give us results in terms of epidemic. I mean, declining a number of HIV cases and declining mortality in the cities. And of course, the city of Kyiv combines the resources the city resources with other resources from the national level and from donors, and it is really in the spirit of the Paris Declaration. Thank you. And now let us move to Odessa. So Odessa was the second one to sign Paris Declaration in Ukraine after Kiev, but as they say in Odessa, Odessa is not the first one, but it is not the second one as well. So that is kind of a local joke. And the mayor of Kiev, Gennady Trukhanov, would like to address the forum participants. So let us listen to Mr. Trukhanov. So I'm happy to welcome all the forum participants and guests, and I would like to thank the organizers for bringing together so many experts in one place, those people who raise really important issues, especially important in the times of pandemic COVID-19, when vulnerable populations are especially vulnerable to the diseases. And also I would like to thank the Global Fund and Alliance for Public Health for our cooperation, which brings its results. And today I can present them to all the forum participants. In February 2017, I signed a Paris Declaration, and Odessa officially became part of the movement of the cities of the world to respond to HIV, together with Bern, Amsterdam, and Paris. And in Odessa, we approved the city program on HIV, tuberculosis, hepatitis, and drug use, Fast Track Odessa. So this program is aimed at comprehensive response to those diseases. And thanks to successful implementation of this program, Odessa was able to take under control the epidemic of HIV and achieve the 1990 targets. And the global Fast Track cities initiative helped us to do that. Odessa was also the first city in Ukraine to join the Zero TB Cities initiative, and it works step by step to overcome the epidemics of HIV and tuberculosis through improving the efficiency of TB care at the primary level. So instead of hospitalization, we have now outpatient treatment of TB, and in polyclinics and educational institutions we have testing for the visitors, and thus the city was able to improve diagnostics and start treatment timely. And today in Odessa we have about 9,000 patients with HIV in Odessa, and 7,500 receive treatment in the AIDS center. In Odessa, we have all the conditions for accessible and fast testing for HIV in all health institutions. And in 11 months of 2021, over 22,000 people in Odessa were diagnosed, and 1,867 cases were detected. And early start of ART, which is also free and accessible, allows people with HIV to live long and complete lives, being part of the society. Apart from that, thanks to the early detection of HIV and early start of ART, in Odessa we have a big reduction of AIDS cases among people living with HIV. In 3 years of the Fast Track Odessa program implementation, the AIDS mortality went down 2 times, from 1,000 to 500 patients. And really, the main task of municipal authorities are the health and well-being of people in Odessa, and we do everything that we can to achieve this goal. I want to address all mayors taking part in the conference. Odessa was able to fully change the strategy of HIV detection and treatment approaches, and our experience in overcoming the epidemics of HIV already has recognition at the global level, and we are ready to share our successes and achievements. I wish you all to have interesting discussions and fruitful work at this forum, so that we can use those results for even more efficient with the socially significant diseases. Thank you for your attention. And And here with us, we also have a deputy of Odessa City Council, Irina Kutsenko. So, Ms. Kutsenko, as we know, Odessa is kind of the first city where the HIV epidemic started in Ukraine. So the epidemic in Ukraine started from the south of the country. But today, Odessa has a big progress in terms of fighting the HIV epidemic, and as well as Chisinau, you already approved the second municipal program to fight HIV, and you have allocations from the city budget for HIV response. So it is interesting how the city responded to the new challenge, the COVID pandemic. So what changes did you make in city responses to HIV and TB in the times of pandemic? Could you share that, please? Thank you for giving me the floor. First of all, as you can see, our mayor is a professional. He knows the terminology and he knows the situation. So on behalf of our mayor, Gennady Turkhanov, I would like to say thank you, first of all, to the city, like our twin city, Istanbul, which hosts this forum. And I wish you good luck in treatment and prevention of HIV. And I would like to say thank you to Alliance for Public Health, because you are the ones who is not afraid to knock on the hearts of politicians in our country and in our region. And a big thank you for all your work. I want us to give a round of applause to Alliance, because really, like, reaching people in city councils, that's not easy. And it's not easy to convince politicians to give money for this work. Because unfortunately, many politicians, they are used to what? That the Global Fund gives money. And of course, a big thank you to the Global Fund, because it gives us good result. But as the mayor of our city says, the responsibility for the lives of people lies with us, with the city authorities. And I would like, before answering your question, to address all people here, because this forum is important not only for those us on stage, but all people in this room. Because if you look up now, please do that. You can see this wonderful chandelier, and this you can see that it looks like tears of the patients who were ignored and left behind. And also you can see it as the drops of sweat of people who are doing their best to change the situation. Every person is important, so that is what we understand. And so then our first achievement is multidisciplinary teams. So we are not like saying who is responsible, doctors or public servants or civil society activists. Altogether, we want to reach the 95 targets. We want to help every person in Odessa. And I cannot but mention what we did in the times of COVID. So the first thing that we did, we have emergency care and ambulances which belong to the city authorities. So those ambulances, together with the doctors from AIDS centers, they visited patients and brought ARV drugs directly at their homes. So we did it so that patients do not have to use public transfer, not to have the risk of infection. And we realized that when we give ART for 1 month, we create a special like burden for our medics and risks for our patients. So now we provide 3 months or 6 months ART courses to our patients. What else did we do? Now we have more confidential counseling rooms in the city. Now we have 19 of such rooms, especially to make sure that those who want to come and ask questions, so that they can do it close to their home and bring services closer to people. What did we do for OST program patients? Together with an NGO, OST drugs were given to people in the OST sites, but we provided transportation for those people so that they don't have to use public transport. Also, what we do, we have self-testing, so a person can go to the website of the AIDS Center, and they can order a test for HIV, and they can receive a HIV test by post with instructions on how to do the test and where to go, and where they can seek help in case if the test is positive. And also at the sites of vaccination for COVID, we also offer testing for HIV, hepatitis, syphilis, and other diseases. And together with me, I have a deputy of Odessa City Council, Levon Nikagasyan, who is also head of the health department. And please give him some applause, because when we have really good heads of health departments who care about the health of people, that really helps to change the situation. So that is the experience of Odessa. We are open, we are a warm and friendly city, and we are happy to share the results that we have, and we are happy also to have some meetings or discussions at the level of mayors and at the level of NGOs as well. Thank you for providing me the floor. Thank you, Ms. Kutsenko. The experience of Odessa is really impressive. And let us move forward. So now we are moving to Kyrgyzstan, another place on the map. So I have a question to Venera Reskulova, Deputy Mayor of Osh. So we know that in the times of COVID, you did everything that you could to ensure uninterrupted treatment, especially for labor migrants who are outside your country and who had problems with access to treatment. Also, there were successful campaigns to provide testing in the street markets and other public places. What else could you tell about the programs that you implement within the Fast Track initiative in your city? Thank you. So I welcome all the participants of this Health Sustainability Forum, HIV and COVID in EACA countries. First of all, I would like to greet you, and I would like to give the warmest regards from the Mayor's Office of the City of Osh and Almazov Mametov, the Mayor of Osh. So today our Mayor's Office takes action to eliminate the epidemics of HIV, tuberculosis, and of course the pandemic, which influenced all the countries, I mean the COVID-19 pandemic. So the Mayor's Office of Osh in 2019 signed the Paris Declaration, which was signed by over 240 cities in the world. So at this platform we have a wide dialogue on interaction between countries and cities and international organizations, which allows to provide targeted resources for the HIV and TB response in the city. So Kyrgyz Republic at all the stages of HIV response was the leader in the EECA region in implementing innovative approaches. So our citizens have access to the best medicines for HIV treatment. Also, we scale up social contracting programs with the saliva and blood tests. We have public procurement programs, and the country provided 63 million soms to procure medicines and diagnostics of HIV. So the city of Osh gradually joins this process and makes new steps in terms of social contracting, providing 1.2 million soms. And also I want to say that within the Paris Declaration in 2020, the city municipal program on HIV and TB in the times of COVID-19 was developed for 2020-2025, which currently is successfully implemented in Osh.
Also, there is interdepartmental working group, and with the support of the mayor's office, the commission to verify data was set up for people living with HIV. In the framework of the municipal program, and that was approved to overcome HIV and TB in the context of COVID for the period of 2021-22, we have implemented 7 activities. These are training seminars, workshops for local territorial officers, and also in local territories we have organized testing points, HIV testing points, and there are mobile clinics in all municipal districts of the city. More than 400,000 people have been tested. We've organized a joint multidisciplinary teams, mobile teams, with the focus on people living with HIV and ART in the context of COVID-19 in the city of Osh. And also we provide to more than 80 patients ART products and food products to their homes. We have also organized dispatch or sending the products, therapy products, to people living with HIV who live outside of the country, more than 100 migrants. And also HIV and PrEP testing became possible in all the clinics of our city, both based on blood test and with using express test. The mayor's office supported allocation of monthly financial support for 49 children of people living with HIV. There's 588,000 soms, national currency, and in the clinics we also supply the breastfeeding formula replacement for HIV babies. We also allocated 300,000 soms for HIV components. For the first time, 13,000 US dollars have been allocating for HIV and TB programs in 2021-22. The Osh municipality will still need to undertake a lot of further steps because challenges fighting stigma and discrimination are still there, and also we need to implement UNAIDS global strategy, and we call on all the cities to activate the processes and to prevent slowing of these activities because of the pandemic. So all of us together, we would like to see our cities flourishing, strong, healthy. And let me once again express gratitude to the representatives of all the institutions, all the services involved, civil society. Thank you all for active engagement. Thank you, Ms. Reskulova. Thank you for your call on all of us not to stop, and hopefully, even under these challenging conditions, we will be able to do a lot of further things, especially expanding the focus of the Cascade 1990 to new objectives and targets to overcome stigma and discrimination. Thank you. So the geography of our project is extensive, and now we move from one extremity point in the east to another extremity, and this is the Balkan region. In this region, in Podgorica, in Montenegro, well, it was one of the 3 cities that signed the Paris Declaration, and the capital, Podgorica, was among the first ones. Then it was followed by Belopolje and Bar. So the question goes to Podgorica that joined Fast Track, and we address the mayor of Podgorica, Ivan Vujkovic, who is going to participate online. So why do cities, municipalities, and communities matter to fight HIV, and what programs are implemented by Podgorica with the focus on key populations?
проблемы со связью технические. Возможно, мы вернемся к связи. Тогда у нас еще вопрос связан.
So we have some communication problems. So then we can go to the neighboring country, to Serbia, and the Mayor Reparic, you signed the declaration in Kyiv in 2019, and the question is, what do you believe your city, Kyrgyzstan, can do in order to improve health of your citizens? Do you believe that fast track is a good instrument, tool to improve health of the citizens, of the population?
The field of public health of the Serbia is regulated by the public health law and a large number of legal bylaws. According to the public health law, the public health system is a system that provides conditions for the preservation and improvement of the health of the population through activities or carriers and participants in public health. Holders of activities in the field of public health are institutes of public health that plan, implement, monitor and evaluate activities in the field of public health, coordinate, harmonize and professionally connect to work of other participants in the public health system to territory for which they were established. Participants in the field of public health and vaccinate are bodies of the Republic of Serbia, local self-government units, health services, social protection system, health advisors, educational and other institutions, public information system, business association, public companies, charities, religious, sport and other organizations and associations, families and citizens. We work all together. We should do all that we can increase the number of young vaccinated people. Areas of public health activities are physical, mental and social health of the population, health promotion and disease prevention, environment and health of the population, working environment and health of the population, organization and function of the health care system, dealing with crises and emergencies. Cooperation between the Institute, NGOs and City of Kragujevac is very active and important in this job. Example, the city helps and provides places for storing vaccines and finances many programs in the field of public health. NGOs help us with the issues that public sector cannot handle, and that connection is very strong. We have high level of vaccinated people because we connectly communication with them about the important to vaccination and the good it brings to all generations.
Thank you. Thank you, Mr. Ribaric. And it's very good to hear that actually fast track you kind of built this approach into the classic system, public health system, that includes all aspects, social aspects, and that makes it possible to join efforts of the municipality, of the national government and NGO. Thank you. Thank you. And another member of the panel discussion is a representative of the city where we hold this forum today, Istanbul. Istanbul has not signed Paris Declaration. However, they are doing a lot in the field of public health, including HIV, TB, and the COVID pandemic. So the question goes to the head of healthcare department of Istanbul, Andel Accelerate. So what are the preventive and mitigating actions against COVID-19 pandemic were implemented by Istanbul Metropolitan Municipality? And also, maybe you could share some practices, what kind of practices do you deploy against diseases such as HIV and tuberculosis?
Thank you. Saygıdeğer belediye başkanları ve değerli katılımcılar, ben Doktor Önder Yükseler Yiğit, İstanbul Büyükşehir Belediyesi Sağlık Dairesi Başkanıyım. İstanbul Büyükşehir Belediyesi Başkanı Sayın Ekrem İmamoğlu adına bu programa katılmaktan büyük bir onur ve mutluluk duyuyorum. Kıtalar ve kültürlerin buluşma noktası olan İstanbul'a hepiniz hoş geldiniz.
Distinguished mayors and distinguished participants, my name is Önder Yükseler Yiğit and I'm the head of Health Department of Istanbul Metropolitan Municipality. I am honored and delighted to attend this event on behalf of our mayor, Mr. Ekrem İmamoğlu. Welcome to Istanbul, where continents and cultures meet.
Değerli konuklar, İstanbul Büyükşehir Belediyesi olarak çalışmalarımızı halk sağlığı önlemek adına geniş bir yelpaze ağı içerisinde sürdürüyoruz. Dünyada COVID-19 salgını başladığında Sayın Başkanımız Ekrem İmamoğlu'nun talimatıyla bir eylem planı oluşturduk. Koordinasyon merkezimizi kurarak çalışmalarımıza büyük bir hızla başladık. Devamında ilgili meslek odası temsilcilerinden oluşan bilimsel danışma kurulumuzu hayata geçirdik.
Distinguished participants, as Istanbul Metropolitan Municipality, we prioritize public health and provide our services on a large and varying scale. Starting from the first cases of the worldwide COVID-19 pandemic, with the instruction of our mayor, Mr. İmamoğlu, we developed our action plan, established our coordination center, and started working on the issue at hand. Subsequently, we implemented our scientific advisory board, which consists of the relevant trade association representatives.
Arapça, Farsça, İngilizce, Türkçe, işaret dili gibi farklı dillerde hazırlanan görsellerle salgında yapılacaklar ve korunma yolları ile ilgili İstanbulluları bilinçlendirdik. Hızlıca mobil hijyen filomuzu kurduk. Halkın yoğun olarak kullandığı kamuya kapalı alanlar, toplu taşıma araçları ve tüm dinlerdeki ibadethaneler olmak üzere ayrıca park bahçeler dezenfeksiyon işlemlerini yapmaya başladık ve halihazırda da devam ediyoruz.
We raised awareness on what to do against the pandemic and how to stay safe. Visual material in different languages such as Arabic, Farsi, English, Turkish, and sign language. Very quickly, we put together the mobile hygiene fleet, and it started disinfection efforts in intensively used public spaces, such as health institutions, public transportation vehicles, parks, gardens, and sanctuaries of all religions. Today, the fleet still continues its operations.
Covid-19 salgınının başlamasıyla birlikte tamamen yaşlı bireylerimizin bulunduğu İstanbul Büyükşehir Belediyesi İstanbul Darülceze Müdürlüğü huzur ve bakım evlerinde uygulanan olağanüstü önlemler sayesinde dünya standartlarında başarı elde ettik. Yaptığımız başarılı çalışmaları bilimsel bir makale haline getirdik. Makalemiz Turkish Journal of Geriatrics dergisi tarafından 2021 yılı ilk sayısında okuyucularıyla paylaşıldı.
Thanks to the extraordinary measures taken after the start of the pandemic in our municipality, almshouses, which consist of elderly entirely, we achieved a success rate that is above world standards. The successful measures were compiled in a scientific article and later published in the first 2021 edition of Turkish Journal of Geriatrics.
Belediye olarak evlerinde yatağa bağımlı ihtiyaç sahibi ailelere evde sağlık hizmetlerimiz pandemi sürecinde çok yoğunlaştı. Salgının getirdiği psikolojik yükle başa çıkabilmek amacıyla danışan ve personelimizin sağlığı açısından telefonla psikolojik danışmanlık hattımızı kurduk.
Our home healthcare services are provided to the bedridden patients and families in need. They got busier during the pandemic. In order to combat against the psychological burden brought by the pandemic, we established the psychological counseling by phone services for our employees and other relevant clients.
Çalışan sağlığı ve yönetici rehberini hazırladık. Ayrıca termal kameralar ile giriş çıkışlarda ateş takibi yaptık. Uzaktan ve kademeli çalışma modellerinin hayata geçirilmesini sağladık. Salgın sürecinde sokakta yaşamlarını devam etmek zorunda olan evsiz yurttaşlarımıza pandemi koşullarına uyarak konaklama ve istihdam desteği verdik. Günlük 2000 sağlık çalışanlarımıza otellerde ücretsiz konaklama, ücretsiz otopark ve toplu taşıma hizmeti desteği sunduk. Ayrıca pandemi sürecinde online egzersiz programları düzenledik. Kendi dezenfektanım üretim tesisimizi hayata geçirerek kullanacağımız dezenfektanı üretmeye başladık.
We prepared guidelines for employee health and for executives. Additionally, we started using thermal cameras for temperature measurement at entry and exit points in buildings. We implemented remote and shift-based working models. Throughout the pandemic, we provided accommodation and job placement support for homeless citizens. We provided free accommodation at hotels, free parking and public transportation to 2,000 health workers each day. We also conducted online exercise programs during the process. Finally, we finished the construction of our own disinfectant production facility and it started production.
Salgının halkımıza getirdiği sosyoekonomik yükü sosyal dayanışmayla aşıyoruz. Su, doğalgaz gibi belediyece sağlanan hizmetlerin faturalarını ödeyemeyen ailelerin borçları ertelendi. Yine belediye kaynaklarıyla gıda, nakit yardımı ve kıyafet, eşya gibi yardımlara halihazırda devam ediyoruz.
We are overcoming the socio-economic burden of the pandemic with solidarity. When it comes to services provided by the municipalities such as water and natural gas, the debts of families that can't make their bill payments have been postponed. Similarly, we continue to make food, cash, clothing and furniture aids using municipality resources.
Bulaşıcı hastalıkları önlemek adına ayrıca sivrisinek, fare, kene ve benzeri canlılarla yılın 12 ayı kesintisiz mücadele ediyoruz. Yerel yönetimlerde ilk defa vektörlerle mücadele bilim kurulunu hayata geçirdik. Avrupa Hastalık Önleme Merkezi'nin raporlarını uyarlayarak sivrisineklerle mücadele eylem planı hazırladık. Vektörlerle mücadele coğrafi bilgi sistem otomasyonu ve aplikasyonunu hayata geçirdik. Akdeniz'e kıyı ülkelerde halk sağlığını tehdit eden Aedes albopictus, istilacı sivrisineklere yönelik AIM-COST aksiyonu 3. yıllık kongresini dünyanın saygın üniversitelerinden katılan bilim insanlarıyla İstanbul'da gerçekleştirdik.
We relentlessly continue our year-long fight against mosquitoes, rats and ticks to prevent contagious diseases. In line with this, we implemented a scientific board for combating vectors for the first time in local governments. Adapting the reports of the European Center for Disease Prevention and Control, we developed an action plan regarding the fight against mosquitoes. We finalized the geographical information system automation and application on the fight against vectors to discuss the very invasive Aedes albopictus mosquito species that poses a public health threat for Mediterranean countries. We organized the third AIM-COST annual conference in Istanbul with the participation of scientists coming from the reputable universities around the world.
Programın ana konularından olan HIV, AIDS, tüberküloz alanlarında ise ülkemizde çalışmalar Sağlık Bakanlığı tarafından yürütülmektedir. Yerel yönetim bilimleri olarak bizler daha çok halk sağlığını koruyucu, önleyici alanlarda aktif çalışmalar yürütüyoruz.
When it comes to the main subjects of this event, HIV, AIDS and tuberculosis, all efforts in our country are carried out by the Ministry of Health. As local governments, we are mostly active in the protective and preventative side of public health efforts.
Halk sağlığını korumak adına yaptığımız çalışmalar sadece Türkiye'nin değil, dünyadaki tüm yerel yönetimlere rol model olacak niteliktedir. Hizmetlerimizi sizlerle paylaşmaktan dolayı büyük bir mutluluk duyduğumu belirtmek isterim. Programın çıktılarının halk sağlığına adına katkı sağlayacağına inanıyor. Emeği geçen tüm katılımcılara en kalbi duygularımla teşekkür ediyorum.
Our efforts and projects to protect public health present a role model for not just national local governments, but for international ones as well. I would like to point out that I am very happy to share our services with you here today, hoping that the outputs of the event will be beneficial for public health. I would like to sincerely thank all participants and organizers of the event. Thank you.
Thank you, Mr. Igrit, for all the work that you are doing. And we were able actually to hold this forum here thanks to your efforts and thanks to the fact that you made Istanbul a quite safe city. And we have Podgorets with us remotely. So we would like also to hear the response from the mayor of Podgorets.
Dear participants and organizers of Health Sustainability Forum, allow me to extend warmest regards from Podgorica, Montenegro. Unfortunately, I was not able to join you in Istanbul in person, but I'm delighted to contribute to this event and share results of Podgorica regarding the previous period. Since December 2019, Podgorica has been actively working on providing support for achieving 19-90-90 targets and improving the local response. In the previous period, for the first time, our social policies and strategies have recognized population affected by HIV as one of the priority groups. Today, we're making 2 years retrospective on what has been achieved and meanwhile questioning if there could have been done even more. 44% of all HIV cases in Montenegro are registered in Podgorica, while a majority of them are diagnosed in the final AIDS phase. We regard this as an obligation to expand actions and services, improve policies, and increase funding that will ensure that testing, early diagnosis, and treatment are available and accessible to everyone. All of this has been challenged by the COVID-19 pandemic that threatens to jeopardize HIV response worldwide. This is why local communities and cities should step up and reach out to the key population groups, support service providers, and join forces towards ending AIDS. COVID pandemic has also challenged both myself and my team to think about innovative services we could offer to our citizens, with a special focus on the most vulnerable ones. With that aim, we have established in July this year the new social service called the House of Health, in which, together with NGOs, we provide social and HIV prevention services, education, and psychological support. The role of cities, local communities, and mayors is important in increasing funding for HIV, but even more important in addressing the needs and vulnerabilities of key populations. For decades, unfortunately, stigma and discrimination remain huge challenges, but also the greatest obstacles along the path of increasing testing rate in Montenegro. Over the next couple of months, we will introduce action plan on Paris Declaration that will represent a step towards fulfilling our promise regarding ending AIDS by 2030 through the improvement of local response. Dear friends, I'd like to thank our partners from CAZAS, a prominent NGO from Montenegro, and organizers of Health Sustainability Forum for recognizing Podgorica as a good example, but also for providing us with the opportunity to gather and exchange best practices. Thank you very much for your attention. Vice mayors and cities attending, dear participants and organizers of Health Sustainability Forum, allow me to extend warmest regards from Podgorica, Montenegro. Unfortunately, I was not able.
We would like to thank the last speaker and all the panelists. I would like again to underline the importance of the contribution of the cities in response to the pandemic, and we will continue supporting fast-track cities in 2022-2024. And Vice Mayor of Chisinau, Fadej Nagachevsky, would like to say once more, add to what he said. First, what I want to say is that we were able to do a lot. Like, some of us prepared strategies, others some action plans. Some of us were able to start implementing the strategies, get funding from the national budget and from the municipal budget. It means that we are doing the right thing, and the fact that we are all here, it means that there is a general consensus and solidarity. So on behalf of the mayor of Chisinau, I would like to say thank you to Alliance for Public Health for their support, because many things could not be done without your support. And I would like in particular to say thank you to Mr. Klepikov, who was able to organize this forum, who is always next to us. And on behalf of the mayor of Chisinau, we would like to give you the diploma and invitation to come to Chisinau, to our mayor's office, and so that we can show what we did in implementing the programs that we coordinate together. Thank you. It is a big honor for me. I will try to use this invitation, and thank you for the important actions and steps that you do. Thank you. Okay, so thank you very much to the wonderful moderators of this discussion and all the speakers. So this round of applause is for you. And could you please come here on a stage so that we can make a photo together?
I would love to ask you to make a group photo in front of our stage. So please, with the help of our audience, a big round of applause. And everyone here, thank you for such a fruitful discussion. Ну что ж, дорогие друзья, тем временем, пока у нас происходит...
So, dear participants, we have a small photo shoot here, and now I want to make a small announcement about what we're gonna have next. So, we stay here for the press conference, and it means that we invite our dear journalists so they can come closer and they can bring their cameras. They can get all the equipment prepared to take part in our press conference. And that's a historical moment. Thank you again, and please some applause for our speakers. So now we will bring all the people back, everybody whom we need. So what is going to happen now? So on stage now we have some preparations, and I would like to say that for the press conference we have 30 minutes, and you can ask a question to our speakers in the chats. And of course, here in the room, you can raise your hand, and our hosts will give you the microphone. We are monitoring all the chats at all platforms, and we will respond to most interesting questions which are asked right now during the press conference. So first, we will respond to the questions of accredited journalists, and we are almost ready. So, dear friends, I would like to remind you that this press conference will be mostly for the online broadcasting, but all people here with us in the room, you can also stay and listen and observe and take part in this discussion. And those who are ready to go to the next stage, I would like to make an announcement that at 2:30 we will have our next panel discussion. So if you are leaving us now, I want to say that we are waiting for you at 2:30. So I see that we are all set up almost, and I will be inviting the participants of our press conference. And before we start, I would like to say the topic. So the topic of this press conference is aggravation of the situation with the human rights, HIV response, and health of migrants during COVID-19 pandemic in EECA region and Balkan countries. So the participants of this press conference are are the people whom you already seen on the stage. So Fadej Nagachevsky, Vice Mayor of Chisinau, Moldova. Yeah, so please support our speakers. Anna Starostenko, Vice Mayor of Kiev, Ukraine. Venera Ryskulova, Deputy Mayor of Osh, Kyrgyzstan. Nikola Ribaric, Head of Local Administration, City of Kyrgyzstan, Serbia. And Irina Kutsenka, Deputy of the Odessa City Council, Ukraine. And we also asked Pavel Bem, Commission on Drug Policy in ECA countries, and ex-mayor of Prague, please join our wonderful team, and also Andrei Klepikov, please join the team of speakers, and Denis Godlevsky, Coalition on Preparedness to Treatment, Russia. So once again, Nikola Ribaric, Head of Local Administration, City of Kyrgyzstan, Serbia, please join us. And if he's not here,
Nikola Ribaric. If you can hear us, we can start. Итак, мы начнем, а Никола присоединится к нам.
We start and Nikola will join us. So the first question is to Denis Godlevsky from Rita Loginova, portal Такие дела, Russia. So this question, in Russia and probably in other countries of the region, the system of providing health services to people living with HIV is isolated from the general health system. And even now, the systems are overloaded. So what will happen if all people who are not covered with treatment now in the nearest future will come to get pills to the AIDS centers? So what can we do to avoid any possible problems? Good afternoon. Thank you to the organizers. It is nice to be in such a big group and a great team of people. And it is a pity that from Russia, as the leading country in terms of making the biggest contribution to the epidemic in the region, we don't have people from the municipal authorities, and I hope that the situation will change over the time. So that is an important and interesting and strategic question. So it is true, at least for Russia, and the existing system of infectious disease centers, it is really isolated, and it is not integrated into the general health care system. And it becomes a bottleneck where we have problems with the necessary diagnostics, with antiretroviral treatment, and doctors are overloaded, and they are not to blame for that. It's just the remains of the system which we organized back decades ago. I think that strategically we need to start speaking about the centralization of those services right now, to integrate HIV services in general health systems. And I'm sure that the countries of the region which chose this path, they made the right choice, because all health professionals need to know how to work with the HIV, because it reduces the level of stigma, it raises the awareness and the literacy of doctors, it reduces stigma of patients, and it reduces the probability of human rights violations in health facilities, etc. So the countries which still have this isolated system of HIV services for people living with HIV, they need to think forward, and they need strategically to prepare and change their education programs in the universities, their training programs for nurses, for such decentralization, because sooner or later it will happen. It's just a question of time. Thank you, Denis. And we have a similar question addressed to Andrei Klepikov. Такие дела Логинова. So what will happen if all people who are not covered with treatment, they will come to aid centers to get treatment in Ukraine, Moldova, Balkan countries. So are health systems of the countries ready for this situation? Thank you. Well, actually, I would like it to happen. It is actually our dream for people to seek help more. It is needed, it is critical, and people who need treatment and seek treatment, they can become the driver of change. That is what happened in South Africa when the patients were the main force and the main driver of reducing prices by dozens of times. And I'm sure that in our region we need more patients. And about the specific solutions, they are possible. And I agree to a big extent with what Dennis said, that without the engagement of primary healthcare facilities, we cannot deal with hundreds or thousands of new patients. And of course, we need to overcome the barriers that we have, stigma, discrimination. We need to reduce prices for medicines and use the technologies, because COVID showed us that telemedicine is also something that can work, as well as remote deliveries of drugs. And I'm sure that we can cope with that. Thank you for your response. And the only thing I would like to say to our dear speakers that we have few time and a lot of questions. So let us be more dynamic and let us try to be brief. So a question to Venera Ryskulova from Birmet Ulanova, Cactus Media, Kyrgyzstan. So how successful is the work on raising their awareness about HIV in Osh? Because despite all the efforts, we still see the stories when people living with HIV are made to leave their homes because they have HIV. So there was a person who came to our mass media with this problem, and he's not alone. Well, actually, the question on working with migrants on HIV. We have not done that before, but now migrants are included as a separate group in the national program on HIV, and we plan to scale up testing among migrants and scaling up awareness-raising activities, and we plan to have intergovernmental negotiations to give access to testing and treatment for migrants in the countries where they live. And for all migrants living with HIV, now we have delivery of medicines. We provide medicines for the period of from 6 to 12 months, and our partners through the friendly clinics in the countries, they help us to promote this work and to provide tests on viral load for those people who were diagnosed with HIV, not in Kyrgyzstan, outside of Kyrgyzstan. But in this area, still, we have a lot of things to do. Thank you. And another question. In Osh and Osh region in 2006-2007, there were massive infections of HIV among children in hospitals. So most of them are now close to 18 years old, and after they become 18 years old, they will not get benefits from the state. So the question is, this question raised to provide some payments or other benefits for them?
Thank you for your question. In the law, it is stipulated that HIV positive children, after they come of age, after they become 18, they no longer have access to those allowances, but immediately we register for them the disability status. And respectively, the amount of the allowance goes a little bit down. However, upon the initiative of the parents in November, we had an interregional seminar, and there we signed the resolution. And there we indicate that we will provide children older or people older than 18 with the respective allowances and one-time lump sum payment 100,000 somas. The next question goes to Mr. Nogachevsky from Newsmaker Moldova. Municipal plan in Chisinau stipulates that money is going to go to key populations. Have you heard any counter arguments that it would be more important to use this money to build roads or to support retired elderly people? And if yes, how did you defend allocation of these funds for HIV/AIDS? Thank you for your question. Well, we live in an open space, open state, democratic state, and there are different opinions on a variety of issues. In this case, of course, we have heard different voices. I did talk to representatives of the healthcare community about the adverse effect of such policies. However, we arrived at the consensus on that the right to health, to life, to be integrated to the society is something that prevails over the right to having access to good roads. So sometimes you need to postpone repairing a road if we can save at least one life. I mean, in this case, nobody tried to resist this initiative. Everybody agreed with that consensus that we need to implement the policies that would guarantee the right to health, integration of our categories of citizens as we're discussing now. And this consensus was not only with the citizens, but also with the authorities at the national and local levels, and we developed partnerships there. And based on that, we can keep implementing the policies and setting new priorities, objectives, and achieve those objectives and targets. Thank you. The next question goes to Denis Godlevsky from Kommersant, Russia. The Minister of Health of Russia says that the situation regarding prevalence of HIV is improving in Russia. Does UNAIDS see these positive dynamics, and what are the outstanding issues that need to be addressed in Russia? I believe this is a question to UNAIDS. You know, it's difficult to speak on behalf of UNAIDS representative. Maybe they could follow up on that question. Let me just comment that I believe that certain positive dynamics are observed, and here it is important to understand which period we're speaking about. In the recent 10 or 5 years, the number of people on ART, above all, has grown significantly. However, on the other hand, we still see that significant gap of statistical data that is available to the Ministry of Health of Russia and the Federal Service for Epidemiological Surveillance, Rospotrebnadzor. They use different approaches, different forms, and where Ministry of Health may indicate some reduction, downward trend for Rospotrebnadzor, it may be the growing trend. So to avoid this confusion, I believe that it is important to keep in touch with UNAIDS, and for the two Russian agencies, it was important. It would be important to agree on their approaches and which practices and they use based on the standards for international surveillance. Ekaterina Ivashchenko, the regional group for health of migrants to Venera. So if in your city you have support programs for those citizens who go to work abroad, if you provide HIV testing and some advice on the legislation on communicable diseases in the host countries, and where from do you fund these programs if you do have them? Speaking about migrants, let me mention that for migration and HIV prevention, as I mentioned, we haven't been active working with this category of citizens. And now to support our HIV-positive migrants, we supply the medicines on the ongoing basis to them. We register them for further follow-up. And in that area, we will still need to do a lot of work to support our migrants. Thank you. Thank you. Next question from Ekaterina Ivashchenko, Regional Group for Health of Migrants, goes to two speakers, Irina Kutsenko and Ms. Tarastenko. Whether in your city it is possible for foreign citizens to have access to HIV testing and treatment, and what are the funding sources for those? If I may, let me start. I will speak about the city of Odessa. In Odessa, we don't have that program. However, our fast-track program that we are implementing covers refugees that have the official status. We have a refugee center and facility for migrants. So if these people get this official status, they have access to treatment. Apart from treatment, we also do testing. There, we do not check if the individual is a citizen of Ukraine or a citizen of another country. It is important to know how many HIV-positive people we have in our city. But for treatment, for ART, there we do expect that the person has this medical record proving that officially they live in the territory of our country. We have a similar situation, actually. At the level of primary anonymous testing, everybody has the right to have that test, and we never check their documents. But if the disease is detected, there are these requirements. In Ukraine, we have developed a new draft law that's going to regulate that situation, and now it has been submitted to the parliament for consideration. But for us, for the city, what matters is the human being and the health, human health. This is the priority. So we do try to allocate funds from the city budget or to involve patient organizations, charitable organizations to address that issue. We understand that these people live with us. No matter if they have those documents or not, they need treatment, and so we provide them with that opportunity. And let me add that, for example, last year, together with NGOs, our city tried to assess the situation at the migration center. Out of 300 people who were tested, we detected 5 HIV-positive people. So now they are undergoing treatment and their viral load situation is improving. Thank you for these answers. Next question goes to Nikola Ribaric, Versov Portal, Ukraine. In Serbia, the indicator of COVID vaccine per 100 people is 115.9. Globally, it is 104. So the average indicators for Balkan countries is much lower. So what's the situation regarding COVID vaccination in your city, and how do you work with those who oppose vaccination, who do not want that?
Activities in the field of public health are institutes on public health that plan, implement, monitor and evaluate activities in the field of public health, coordinate, harmonize and professional connect the work of other participants in the public health system to territory to which they were established. Participants in the field of public health and vaccines are bodies of the Republic of Serbia, local self-government units, health services, social protection system, health advisors, educational and other institutions, public information system, business association, public companies, charities, religious, sport and other organizations, association, families and citizens. we should do all that we can to increase the number of young vaccinated people. And in Kragujevac improved. It's a very important cooperation between two institute NGOs, and the local government is very active and important in this job.
Thank you very much. Мы продолжаем, and the next question is to Pavel Bem from Bermetulanova Cactus Media, Kyrgyzstan. And the question is, at the end of November, the Commission on Drug Policy of Eastern and Central Europe and Central Asia paid an official visit to Kyrgyzstan. Will the Commission's visit affect the changes in drug policy in Kyrgyzstan, and how?
Thank you very much for the question. First, I'm from the Czech Republic, former mayor of Prague. However, reflecting and addressing your question, the Eastern and Central European Commission and Central Asian Commission for Drugs has organized the country visit to Kyrgyzstan, assessing the situation in Kyrgyzstan, and I briefly can say that we were really amazed by the challenges and opportunities related to the drug policy reform. So we see good figures looking at numbers of harm reduction services and human rights oriented services for those using illicit drugs. We were really pleased by looking at the numbers of incarcerated people among drug users, really seeing that there is a beginning of the criminal justice reform, which is prioritizing more and more the public health protection, human rights services and public health services more than the criminal justice interventions. So Kyrgyzstan is one of the countries, according to our opinion, which is showing example of a good practice, and we trust within the Commission, which is led by former President of Poland, Aleksander Kwaśniewski, that examples of a good practice is like an open window or open door for introducing the changes across the region.
Thank you very much. One more question from Alexander Levin, Drug Users News. What is the specificity of our region in terms of drug policy, and in connection with what it was necessary to create a regional commissions as opposed to an international one? What are the tasks of the regional commission?
I think we are all aware of the fact that the region is in quite serious situation as far as drug use, HIV, hepatitis C is concerned. We are all aware here, and therefore we are also here, that approximately 25% of people who inject drugs globally are living in the region. We are all aware of the fact that the seroprevalence of HIV among drug users and the incidence of HIV is just in this region growing. It's one of two regions around the globe. So we are confronted with epidemic in some countries, with significant public health concern in others. But in general, it pushes us to think in terms of what is going wrong. What are the constraints? What are the risks involved in? And one of the risks involved in is lack of the political commitment to introduce drug policy reform to be more human rights and harm reduction oriented to services more than to law enforcement. And we are all, who are just present here, we are showing that it's possible to go on in a right way. So the major goal or objective of the Commission is to address the high level policy or political advocacy to revert the drug policies from the law enforcement oriented ones to public health protection ones, to look at the limited resources in the region and in countries, and to invest them in a way which is cost benefit or cost effective for the people and also for the public budgets. And certainly the region is very specific because of the influence of Russia and because of the influence of, I would say, inherited stigma towards people who use drugs. We saw them even in the Czech Republic, which I represent, and we introduced in the Czech Republic 30 years ago significant public health and drug policy reform based on respect to human rights, based on decriminalization, and based on introducing and implementing services for those using. We are having, and there is a lot of evidence that this brings positive effects as far as HIV spread is concerned, hepatitis, as far as overall morbidity and mortality. So we know, in fact, where to go and what instruments to implement. So I think looking at the stigma based on the past, looking at drug users and people who use and specifically inject drug as criminals, we need simply to destigmatize and to open the space for human right-based approach.
Thank you very much. One more question from Alexander Levin, Drugs Users News. A separate question on Russia. Why do you think Russian drug policy, on the contrary, against the background of European liberalization, is becoming tougher and more repressive?
Well, this is again a good question, but if we look at Western countries, we saw and we see that the same was done and represented in Western countries led by the United States for 50 years. The war on drugs was introduced in states, in fact affecting at the end the key bodies like the United Nations. So I would say that the failure is probably more, or at least also on our side, that we were not convincing enough to show and to convince the decision makers and politicians in Russia, to show them what are the real benefits of introducing a reasonable public health oriented drug policies. So how to react on all these unintended negative consequences which are generating the epidemics, for example, of HIV, killing people. But at the end, this is not only about the health, but it's also, again, about the criminal justice and organized crime. Because we see that illicit drugs represent the same economic size, the market with the illicit drugs, as the licit markets with alcohol, tobacco, and cereals together. So it's 320 billions of US dollars annually. This is unbelievable. So to dismantle organized crime power and to put governments into control and in fact to regulate illicit drug markets, it's not a question of legalization. It's a question of reasonable drug market regulation. And this is ultimate goal, even probably above the fact and above the goal of protecting the lives of human beings which are somehow confronted with the use of drugs or HIV or other transmitted communicable diseases. But we should also take seriously into account the fact that worldwide we have 250 million of people using drugs, illicit drugs. So this is a question of respect to those people. And we have far more people using alcohol or tobacco. As far as the global burden is concerned, tobacco is number 2, alcohol is number 5, and so-called illicit drugs, the evil, is number 15 or number 19 actually. So we should take seriously in account a rational, pragmatic brain, definitely evidence-based knowledge, and we should go further and learn on all these examples of a good practice, and I believe that at the end we convince even Russia. It will take probably some time.
Thank you very much. And to sum up, actually, what changes in drug policy in our region do you expect in the very near future? Actually, it is the same person asking the drugs users news from Russia.
Very briefly, I think examples of a good practice will be an open gate, an open door for the others. So we will see much more human right, respect, human harm reduction oriented services in the region. We will see probably in some countries maybe attempts to change the legislation, to decriminalize, at least to introduce much more proportionate sentencing of people who are incarcerated for or just accused for drug possession of illicit drugs. We will probably see, I hope so, the stabilization of the HIV epidemics around the region. We probably will also see attempts to, and I guess probably effective attempts to make the controlled medicine, opioids, painkillers for patients more available in the region. And I think that in some countries we will probably see the changes of legal frameworks as far as the medical cannabis is concerned for medical purposes. So all these continuous changes, which in 10 or 20 years will make the real significant change. As those changes we have seen in Europe, for example, in Portugal, in the Czech Republic, now in Spain, in Germany, in Switzerland, where just introducing of these healthcare-oriented and public health-oriented services were just dismantling, for example, in Swiss cities, the black market with the heroin. So therefore, I am talking not only about public health, but as a politician, a former politician, also about public safety. This is a key aspect of the problem.
Thank you very much. Итак, следующий вопрос Андрею Клепину.
The next question is from independent journalist Ed Holt. So migrants face a higher risk of HIV and other diseases both during their labor migration and after it. So are you worried about the current migration crises at the borders of Poland and other countries, or like further aggression of Russia can lead to the outbreaks of HIV and other infectious diseases? Well, that is a very difficult question, especially concerning the possible attack of Russia to Ukraine. I remember the annexation of Crimea when substitution treatment was not just stopped, but just they stopped it abruptly and they burned the OST drugs. And the patients, they made a video where they were praying and they were asking the world to help them, and every 10th person in this video, they died. Like some of them because of the negative consequences to health, some of them came back to illegal drug use and overdosed, some of them committed suicide, and that is really a tragic situation. And even among the participants, we had patients from OST patients from Crimea who had to relocate to Kiev. And if the world couldn't help them, 800 people, this was the number of OST patients in Crimea. So if we talk about millions of people, I do not see a solution to this issue at the present moment. So God help us to avoid this situation. Thank you. And the next question to Anna Starostenko and Irina Kutsenko from Ed Holt, independent journalist. So what prevention services should be provided by the cities to stop the transmission of HIV or other infections such as hepatitis in the communities of migrants during a migrant crisis and during the normal movement of migrants? And does your city provide these services at present moment? And if not, do you plan to introduce them in the nearest time? Well, this question is closely related to the previous question asked to Irina and myself, and we already said that today at the level of, if we talk about testing, all people can have access to it, including migrants and if refugees. The main thing is to provide access to this service, and we work here with international organizations and with the government agencies, working with the refugees and migrants. And we have this opportunity today, and the main thing in terms of prevention is to find people. And then when during testing we see that we have positive HIV cases, then we try to provide individual help, maybe like our municipal hospitals, they get engaged, or we provide treatment with the help of our international partners who provide funding. So if we detect any HIV cases, we try to give opportunities to everybody to get treatment. And in Odessa, we did a pilot project, and now we scaled it up. So a person coming to any health facility, so we do a multi-testing for them. And why we decided to do multi-tests? Because we saw that the statistics of people with hepatitis C is the numbers are very high. So in fast track municipal program, we stipulated Hep C treatment within the municipal program. So we buy all the 4 types of medications and we provide them to people free of charge. And I would like to add that from the new year in Kiev there will be a new municipal program called Public Health, and from January the 1st, 2022, we will also scale up screening and testing for all people who would like to access such services on the territory of the city of Kiev. Thank you. Next question to Andrei Klepikov from Tajikistan Media Plus portal. So your organization recorded violations of rights in Eastern Europe and Central Asia. How do you plan to use the statistics of 6,000 cases of human rights violations, and how did COVID pandemic influence the situation with human rights in the region, and who are the biggest perpetrators in Tajikistan, and what type of violations is most widespread? Thank you. Really, within the project REACT program, recorded over 6,000 human rights violations, and each one of those cases was addressed. Among the main perpetrators were police representatives, also health workers, and the justice system. And we try not only to monitor human rights violations and help individual people who face such violations, but also to implement systematic changes. And I already mentioned such changes before, so we have the cases of Moldova, for example, which I was speaking about. And about the solutions in Tajikistan, I remember a number of cases about stigma and discrimination, and we had to address them working with the environment of people. There are some paradoxical cases when, because of criminalization of HIV transmission, sometimes there were really paradoxical cases when the husband did not even file a complaint with police, but the wife was arrested by police. And the husband says that no, that's not a problem, but the repressive system still wants the wife arrested. And they are just ruining people's lives. And today, on the Human Rights Day, we started a campaign. Declaration, not decoration of human rights. We do not want decorations. And what we saw is that there are 30 articles in the Declaration of Human Rights, and every one of these articles is violated. So for our region, it is a very urgent issue. And there is a need to change the situation. And during the COVID pandemic, the situation really aggravated, and we need to change the situation with human rights, because without it, we will not be able to move forward. Thank you, Andrei. Unfortunately, we have run out of time. Thank you to all of you that we do not just share information, but we are building the dialogue, we are changing the history, and we make this world better. So thank you a lot. Fadей Nagachevsky, Anna Starasenko, Venera Riskulova, Nikola Ribaric, Irina Kutsenko, Pavel Bema, Andrei Klepikov, and Denis Godlevsky. Thank you to all of you, and we invite you to join your colleagues. You have time for networking, and at 2:30 we are waiting for all of you for our next panel session. Thank you.
So, dear friends, we are happy to welcome you at the next session of our forum, and we are grateful to those who stick with the time schedule. Respect for your colleagues, that's always welcome, but still we take several seconds to come together, and let me present the panel discussion that we are going to have now. So, of course, we continue discussing the most relevant topics associated with HIV/AIDS epidemics and countering this epidemic in the context of COVID pandemic. And the specific feature for this forum is that we cover a range of issues today during this discussion. Those who work with these themes realize that in order to achieve truly sustainable results, it is necessary to have substantial financial backup. Resources of charitable foundations would not be sufficient there. It is important that there is reliable financial cooperation with the state, because funds this may withdraw, but the issues will still be there. And this is something that we are going to discuss in the context of the next discussion. This is SOS project, HIV Service Sustainability Experience with public funding. And I pass the floor to moderator of the discussion, Maxim Demchenko, Institute of Analytics, Analysis and Advocacy of Ukraine. Welcome to you all. And now I would like to invite the speakers. Roman Drozd, Institute of Analytics and Advocacy, Ukraine. Ruslan Paverga, Positive Initiative, Moldova. Georgi Soselia, Georgia. Goran Radislavich, TOS, Serbia. And Dmitry Sharemby, 100% Live, Ukraine. Colleagues, I leave you here. Thank you so much. Colleagues, welcome to you all. I'm so happy to welcome all the people here in the audience, those who watch, who follow us online, who will see the recording. That's a great opportunity for all of us to meet together and to see what outputs, results we have managed to achieve, maybe draw some conclusions. And thus we can speak about the challenges, the problems that we will need to address. Today we have discussed the results extensively, and it is nice to realize that apart from the figures and regulatory documents developed within the project, we have become a part of that large SOS project family that managed to promote, advocate new ideas that became part of life in the regions. That was new paradigm where we said that actually there is no public money, there is state money, there is the money of taxpayers, and there is civil society that is absolutely authorized together with the state to decide on how to use this money for needs of the communities. And it is very nice to realize that this paradigm was implemented in the region. 3 years ago, we launched first budget advocacy schools, and we explained how the civil society could work with the state, how to attract funding. That could seem something like rocket science, something very distant from us, that the government, the state doesn't hear us. But it is nice to see how much the situation has changed over the 3 years. And this process, this work, it's not only about figures, how much money has been allocated, how much has been spent. These are specific cases, new models, new principles of interaction. This is the value that we have due to the project. The processes that have started happening in the countries where municipalities, local authorities came together to negotiate with civil society, to discuss the issues, relevant issues, and look for the approaches. The regulations, the national communication platforms for civil society and the government, that's the value, the assets that we have now. And when we speak about sustainability of services, we need to keep in mind that without the state, it would be so difficult to provide for that. All of us have been fighting in order to make it so that our services became part of the public policy. We do not need on the annual basis to prove once again that our prevention or treatment and care services are needed, are important. We want that to be funded as primary health care is funded or any other healthcare services. And it is so nice to see this huge progress that we have achieved. And thanks to all the members of the panel discussion, to the experts who will share that experience, the experience of working with the state towards sustainability. Today we will discuss those unique cases that maybe do not offer very attractive figures, but we will speak about the models, about the breakthrough approaches. What was not possible in Uzbekistan or Tajikistan is now possible. Or what kind of issues are faced by the countries where there are a lot of money for services, but there are also a range of problems that do not make it possible to use the money efficiently, and the problems encountered by the civil society. We are grateful to all the participants of the panel discussion for your readiness to share this unique experience. And first I pass the floor to Roman Drozd. He will present the experience of the Institute of Analytics and Advocacy. We've been the counterpart in this project from the very beginning. So about the role of civil society approaches for social contracts and first cases, some primary preliminary conclusions, all of that will be now presented by Roman. And I'm going to give you this remote control now. Thank you, Maxim. I'd like to continue with what Maxim has started sharing. 10 years ago, the words social contracting and HIV/AIDS could hardly be heard together. 5 years ago, the state was going to allocate money for vulnerable populations via social contracting mechanisms. Well, we could hardly expect that 5 years ago. So I believe that above all, I will now express gratitude to organizers that social contracting issues and HIV service financing, that now it has become so wide scale. And second important thing that I wanted to share, we have had lunch. That is why, let me say thank you to all of us here in this audience. I mean, without you, we would never have achieved this progress in social contracting and public financing of the services. Let's welcome each other, greet each other, and then we start. So let me briefly present what Maxim mentioned. This is the philosophy and values of the project. This is something without what we would never have any achievements. We understand that in our countries, the main engine of progress is civil society. And that is why from the very beginning, as my colleague mentioned, budget advocacy schools, internships, training, that was the main point of reliance, the main principle to inspire civil society in the countries to promote those changes, to promote that philosophy that the state is going to finance HIV services. And what was important there? We clearly realized and tracked the trends in various countries, and we decided that there was this simple budgetary cycle, and we need to build ourselves into these processes to change the situation, to improve the mechanisms or to launch social contracting mechanisms, and to make sure that the services were funded by the state after the transitional period, from donor to state funding. So first we had to formulate priorities of the government that would be declared and reflected in the public, national or local policies if we speak about municipal level funding. We clearly realized that in every country we need legislative framework that regulate, for example, the law on social contracts, public contracts. We realized that it should be governed by the resolutions and bylaws of the cabinet or the sectoral ministries that are responsible there. We clearly saw that in every country we need to develop a regulatory framework that would remove all the barriers on the path towards sustainable public financing of HIV services. For that sake, we held surveys in each of the countries in order to see the regulatory framework of this or that country and to see the barriers that exist, and so that in the future we could focus fully on amending these regulations and amending the practices, respective practices. Apart from the barriers, we also paid attention to the opportunities available in each of the countries, because all of us understand very clearly that social contracting in a certain area has existed for many years. But when we speak about HIV services, it was not a priority for the state. So there is a number of objective reasons. I mean, international foundations provided sufficient resources. They financed this area, this sector, I mean, providing services to key populations. And that is why our work, together with our partners, counterparts at the country level, was focused on revising, amending the current regulations in those countries. Third important thing, it is budgeting processes. In order to launch these processes and to engage, for the civil society to engage, we also conducted this survey where we addressed and analyzed the budgetary cycle and the budgeting process in each of the countries. And that is above all needed in order to enter the budgeting cycle, to have access to the funding, or to consider another opportunity. This is a reallocation option. Now, our colleagues, the Minister of Health of Ukraine, Andrei Klepikov, they highlighted, emphasized that the option of relocating budgetary funds from one line to another. And this is an opportunity that makes it possible to further develop financing of sustainable HIV services. Another important area is the distribution mechanisms. For us, it was important to understand which models operate in the countries. I just let you know that the time is over. I have not yet started. Okay. So it is important to understand the models, to develop the products, and we tried to do that. And now that is available on social contracting portal, where we have analyzed all the models, service financing models that are implemented in the countries. This is a platform that is accessible, and there it is possible to communicate, to interact. So if the countries have the need to have technical assistance or to have access to best practices, international practices, to development of these mechanisms. Now, just a couple of words about development of the practices of social contracting, because social contracting practices, that's the model that makes it possible to ensure sustainability of services. Having conducted this survey on the available social contracting mechanisms and having identified the barriers that currently do not make it possible for more efficient development of funding of HIV services, there, together with our colleagues and partners, we developed recommendations to eliminate these barriers that currently exist in each of the countries. So to summarize briefly, anyway, the main challenge in this or that country is lack of clear regulatory framework that would regulate the processes of pricing for services. Then increased funding. The practice of social contracting in HIV area would never develop unless the state increases financing of this area. So this is another focus that was in particular emphasized by our project to make sure that this practice develops, and so that even though the countries encounter this COVID pandemic, and this is now top priority for the countries, but anyway, it is important year by year to increase the HIV services funding. And these are 4 key mechanisms that work in countries. This is procurement of services, social order, grant, and subsidy. There are some more, but these are the most prevalent mechanisms. Each mechanism has pros and cons. The most important thing is that they can be improved further, and they need to be improved for 2 obvious reasons. Public funding of HIV services must be provided on the ongoing basis, must be sustainable. Unfortunately, based on our surveys, we see that there are problems of interruption of funding of the services. This is associated with the processes of announcing the public social order or the budgeting processes in those organizations that provide the services, or there may be some other objective reasons. But we can change and revise all of these barriers that exist, and that's what we are doing. In 2021, for services, HIV services, from the state budget, via social contracting mechanisms, as of the 1st of December, the 8 countries that we covered have allocated $4.3 million. If you look at these figures, you see that Ukraine leads because, as we mentioned, at the country level, the financing of services, of these services, is a priority, and this is above all due to civil society of Ukraine, that they're actively advocating, promoting this. They have a legislative framework, as mentioned by the Minister of Health, for the standard of services and pricing policy, and the civil society countrywide is actively engaged and promotes this funding mechanism. And today I would like to speak not so much about the leaders, but the colleague mentioned that we have 2 countries, and let's welcome them because they do have these achievements, breakthrough achievements, Uzbekistan and Tajikistan.
And that's not maybe a lot of funding, but it shows that in those countries, thanks to the active position of the civil society and thanks to the project, mechanisms were launched, and there are the first precedents of government allocations for HIV services. So it is very important because we all know that the first steps are the most difficult, and during the times of COVID, it is important not to lose this progress and to keep moving on. Sorry, we are running out of time. So about the results, we are seeing that today social contracting in the field of HIV is applied in all project countries. Countries are actively pursuing regulatory processes for HIV services. And there are countries with like perfect legislation and regulatory frameworks with the program approved and with the money budgeted for the services, with the standards and cost of services defined. There are countries with all the legal framework developed, but due to some political or other reasons, certain regulatory documents are still being discussed, and there are countries which recently launched social contracting mechanisms. They are moving forward actively, promoting the approval of those regulatory documents to ensure sustainable mechanism to fund services in the area of HIV. It is important to say that if we're talking about sustainability of services, for us it is important to have sustainable project results. So one of the initiatives implemented in 2021, and we hope that we're gonna continue it, is to develop budget advocacy hubs. Why? Because the expertise and the experience in the countries is huge, and actors in the countries are able to provide technical support to actors in other countries or to government agencies on promoting and developing social contracting mechanisms. And there are methodological materials and manuals developed in cooperation with us, and it is important for us to promote the philosophy that we developed, to move forward with that and to get only improved. The strategies and work plans of the hubs are developed for the further periods, and we hope that this mechanism will work in all the countries. It is important that those hubs work to remove the barriers which still exist for the social contracting to move forward. And it is important to mention communication platforms which are being created, and the project showed that it is very important to have such communication platforms for potential customers from the side of the government, for the potential contractors and service providers. And I would like to point out the important role of CCM secretariats. We see that in all the countries, those bodies can support and promote government funding and social contracting. Thank you. Thank you, Roman. Well, briefly, I wanted to point out some conclusions and remarks. So we understand that to ensure sustainability, one of the mechanisms that we can use is to develop and promote social contracting in the countries. And in all countries, there are different cases and model used. And I think that one of the achievements of the project is that we can observe different models, like in Ukraine, they use open tenders. In other countries, there are calls for proposals for the project. In some other countries, there are insurance companies engaged. And all those cases, they are good practices for us to try and find the best possible models and approaches. Roman touched upon the principles that should be the basis, such as uninterrupted provision of services, sustainability and accessibility of services. And it is important for us to remember that we need to ensure the quality of service is acceptable for the clients. And for the country of EECA, the topic of social contracting is quite new. We cannot say that one country achieved great progress within their projects, but we already see some achievements and progress, and we hope that the next 2 years will be really important, because at this moment we already have the legal framework, the cost of services, different models of provision of services, and that is what I mentioned before. It is important to understand that sustainability is not always about money, but also how important certain services are for the government if they are in the legal framework of the government. So the next speaker is Ruslan Paverga. He will speak about the experience of Moldova and how in the country you were able to ensure funding because models are good, social contracting is good, but it is important to know where you can take money from and how to prioritize it in the country to ensure resources for implementation of the models that you use. So Ruslan, please share your experience, but not as Roman did it. Yeah, okay, I'll try to do it. I can just say that in Moldova we are all very awesome, yeah, so I'll try to be very brief, right? Okay, so let us start with the numbers. So that is the funding increase dynamics in the last 2 years, and we see that it's a quite positive dynamics. And speaking about budget advocacy, first I want to say that first of all, we are speaking about the most effective use of funds which are already allocated. That's our first task, and the second task is increase of the budget for HIV. But both tasks, they need to go together. So if we talk about budget advocacy, we need to offer solutions how to most effectively use the existing resources and how to increase funding. So speaking about the experience of Moldova, as I said, in our case, it was important to have some precedents. So it was important to develop the mechanisms and the amounts that were involved. They are secondary. Of course, they are important, but just to create precedents was already an important task of ours. So about the existing funded mechanism, we have open calls of proposals by the medical insurance company, and first of all, health services are covered by this government agency. And this mechanism has been in place for quite a while to cover harm reduction services. There are still some obstacles and challenges. I would like to see that harm reduction services are funded from the prevention fund of this government agency. And so every year, first of all, the Ministry of Health needs to approve the list of priorities for prevention, and then the fund can use this money. So we do not have this uninterrupted a cycle of funding mentioned by Roman. The second problem that we have is about the calendar cycle of funding. So far, we have not been able to make sure that the funding starts at least in February, March, or April. Most often, we have it available in August or September. What is going on with my presentation? That's not mine. Yeah, that is mine. So we need to improve this funding cycle, and there is a question of project documentation. So the good thing is that now we are analyzing two mechanisms used by the state insurance company and another PR of the Global Fund to synchronize those two processes so that all the project documentation and reporting goes together. I don't know, there is something wrong with my presentation. I don't know. Something went wrong. And the second mechanism that we used for funding the services in Moldova is procurement of services within the legislation. And we have the experience of getting funding, not at the national level only, but also procurement of certain health facilities and other institutions like penitentiary system and probation department. They work with us and procure services. And another mechanism which helps us to improve sustainability is integration of peer consultants and social workers in the government institutions. One of the biggest problems for Moldova is that at the present moment there is no big experience and there is no big desire of civil society to get involved in the processes to make sure that they can access government funding, just for the simple reason that now we are in this incubation period, and we are defining the history of what state funding will look like. So now all people who try to do something, they are really important because it allows us to share experience and move forward. That is all from me. Thank you, Ruslan. I will not turn your slides on. You don't need it anymore. So the experience of Moldova is interesting because Moldova is one of the countries which chose the path to ensure sustainability of services when the government created those treatment sites with community centers to provide the services. So part of the services are integrated in health services provided by the government, and also the procurement of services from civil society are supported not only by municipalities and social services, but also there is support of insurance company. That is a very good case for our region, actually, because that is what we strive for. We do not want to prove every year that prevention or care and support services are needed, are necessary. So we want those services to be part of the general healthcare system. So this approach, when the insurance company as the main operator of the money in the health system is a leader in this process, that is a positive experience for our region. Because transformation of health system happens in every country. So those cases are essential. We understand that you are still at an early stage, but we all are keeping a close look at you. Thank you, Ruslan. You wanted to add something? In the region, question is often arises about identification of clients and collection of personal data, etc. So in case of Moldova, at the national level, we found a compromise. We do not collect any personal information to register the harm reduction services, even when they are funded by the government. We use unique codes or unique identifiers, and we have electronic system of registration in the country, and it is highly transparent. So it became a compromise. So at the national level, we decided not to use any personal data, just this unique identifier for the clients. Thank you. And the next speaker is Georgi Saselia. He will tell about the experience of Georgia and the achievements of the recent years, and also about the challenges that they were facing, and will present the unique experience of getting funding for the HIV services. So, Georgi, please, the floor is yours. Thanks a lot, Maxim. So I will make my presentation in English.
Today, and I would like to present the experience of Georgia in terms of the allocation of the state funding in the transition period from the Global Fund to the domestic funding or support of the HIV services.
Can you help technically for us to start the presentations?
So I would like briefly to share with you the overall situation in Georgia. So Georgia is still eligible country to receive the Global Fund funding within the allocation period of the 2020-22 with the implementation for the next 3 or 4 years until 2025. Though Georgia has started the transition period around 4 or 5 years ago and allocated state funding up to date. And if we will look into the plan for the next few years, is already exceeding the share of the state funding already exceeds the share of the Global Fund within the next years. Transition of the core components has took place in Georgia within the last period. It started in 2017, and you can see on the slide the important directions which has been supported by the state budget. It is procurement of antiretroviral medicines, which currently is funded around 100% of the total need of the first-line Ayurveda drugs, and around 80% of the second-line drugs is funded from the state budget. Opioid substitution therapy has been fully transitioned to the government funding, and not only government, they take over the program. However, the scale, the scope, and let's say, budget allocated has been increased numerous times, which has been reflected in the number of people who have been covered, and currently around 12,000, a little bit more than 12,000 patients are covered annually in the opioid substitution therapy program. You can see some other components concerning the time limit we have. I would stop on the last two issues, which is very important. And then since 2020 in country, the component of the funding of the low threshold harm reduction services implemented by civil society has been piloted since 2020. And within the next slide, we can see how the dynamic or increase in the allocated state budget is increasing from year to year, which is very positive dynamic, meaning that the country is taking its commitment and implementing its commitment in allocating the funding for the low threshold harm reduction services. However, it is worth to mention that currently the programs that are supported by government, they are covering the HIV testing and counseling component, and the services related to the distribution of needles, syringes, condoms, and etc. They still remain insufficiently supported, meaning they are still reliant on the international funding. Well, there are certain challenges which remains currently in country, and today in the morning I think Pavel Bem mentioned the term promising challenges, and I think this is the case, and I understand it in a way that the promising challenges are the challenges which we can turn into the opportunities or possibilities, and basically talking about the experience or the role of the civil society, and to recall what have been told by the colleagues, that constructive dialogue and joint efforts of the civil society and the state authorities will finally lead us to the positive, let's say, overcome of the existing challenges and barriers. And I can say that Georgia is one of the case in terms of that, because the readiness of the authorities responsible for implementation or decision making to collaborate with civil society is in place. But in scope, people will look at it, we can say that also to recall what have been already mentioned, that sustainability is not only about allocating the budget or funding. However, it is about the preparedness of the health system and its building blocks. And here are the few of them which I would like to list. It is the financing mechanisms, legal or regulatory framework, especially for, again, the low threshold services, procurement mechanisms, and most importantly, what we call the external factors or critical enablers, or in our case, disablers, which affect the sustainability or in more general access of people to the services. And in case of Georgia, we can mention the drug policy, or we can mention stigma and discrimination, which in a way is also systematic or institutionalized stigma and discrimination towards, let's say, LGBT community. And I think people from the region are informed about the processes that took place in Georgia on the 5th of July, and all of this, it brings the discussion about the governmental support to the services to keep operations on more high-level political agenda. And just briefly to summarize, let's say Georgia has so far made a very significant progress in ensuring sustainability of HIV response, or in meeting its, implementing its commitments in terms of allocation of state funding. Low threshold services for key populations are the one that should be priority for the next few years. And strategic level and participatory dialogue among civil society, communities, and government should be further maintained and implemented. And last 2 points, if I may. I would like to say the two things, like two core messages from myself. So the one is that I think when we talk about sustainability, we have two main modalities, let's say. The modality number one, it recalls the preparedness of the health systems to be ready to overtake or implement the services for key populations and maintain what have been achieved so far with the international support. However, in my perspective, and here I come to the second point, is that sustainability is not about sustainability of status quo what we have. However, it is the sustainability of outcome, of health outcomes of the people that we work for. And in this case, I think we have to think about not only to maintain what is already present, however, to think how we can evolve the programs, or how we can answer to the ground level needs of the beneficiaries. And in this case, what I think we lack, not only in Georgia, but in the region overall, is the discussion about broader scope of the needs apart from HIV, because harm reduction idea and the concept is a bit broader. And when today the mayor of Bern was talking about the low threshold services or how they responded to the needs, it was not about HIV as the primary point. It was about the human rights, and it was about meeting the other needs. So I think this is the important point which we are at the moment kind of missing in the discussion around sustainability. So thank you.
Thank you so much, Georgi. As you have mentioned, one of the challenges, apart from the regulation and understanding and support from the state, it's also important to understand where you take the money. And I believe that this will be the relevant challenge for all the countries for years. And as we often say, the transition plan can only be started, but can you really complete this transition? Every year you encounter new challenges. Each year you need to think about where you take the money in order to make sure that there is sufficient amount of money to meet needs of the clients, and the changes. There will be changes in the challenges. We will need to look for new approaches to funding, and funding will be the key instrument to address all of these challenges. A lot of countries, in order to address this issue, have invested a lot of efforts in order to develop adequate policies for the states, so that for the government allocation of money for HIV services were strategic. Many developed national programs, roadmaps, transition plans that were approved at a high level, at the level of the cabinet, or that would be the roadmap of the Ministry of Health, or at the level of the parliament, if it is about some national programs. And it will be very interesting for us now to hear about experience in this area, about how to develop, together with the state, how to develop political documents, policy documents that would define the strategy for the state for the next years, that would decide on the priorities, where to allocate money, how to monitor, how to assess compliance with commitments of the state. So now the floor goes to Goran Radislavljevic. Please introduce your experience to the colleagues. Thank you so much, Maxim.
Past, I have only 43 slides, and I think that I will finish in next 4.5 minutes. Sorry, I sometimes I make joke, and last time on some conference, I joking regarding IRV optimization and regimes in Serbia, and said that regimes in Serbia top secret like price of some monument in Serbia, and then I don't have a problem with government in Serbia, people from Ministry of Health, but I have a problem with the deputy minister from Montenegro. She's very angry. But now I will be serious. For the beginning, I think that I make some overview of situation in Serbia, because a lot of you maybe don't know situation in Serbia. Serbia is one of the countries where the Global Fund stopped financing in 2014, and also in that time government stopped and don't have any cents, any euro from the government side for the services in Serbia. And we have some gap, maybe in 5 years. Then we get a new grant, and now we are implement that grant and start with the implementation, with the co-financing with the Ministry of Health. If we look and we speak about HIV response in the Republic of Serbia, has a tradition more than 30 years. On last conference, I said that there is 30 years from first World AIDS Day, and also our first civil society organization who work in the field of HIV, founded in 1991 also. And there is a period from former Yugoslavia, and it's first organization in Yugoslavia who work in the field of HIV, and we have a tradition of 30 years. If we speak about antiretroviral therapy, treatment became available in late 90s. Wait a minute. Now we have a national action plan approved in 2018, indicates the priority areas based on national strategy 2018-2022, but we don't start to prepare new action plan from the period from 2022 to the 2025. The budget in Ministry of Health is the main domestic funding source for HIV response now in Serbia. But if you look, I don't know, 3 years ago, it's only around 46,000 euros for 15 organizations for the whole disease. There is no projects for in that moment for the HIV. Most of the local self-governments have public halls where the civil society organization can apply. But also, I must say that we have a very strong law for financing of civil society organization, and every year government, ministries, and local municipalities open call for the projects. Then, in the end of the 2019, 3 consultants, Taras, Igor Kostić, and Predrag Đurić, start to prepare some kind of strategic roadmap for the next period. And in that moment, options for the improving of the sustainability go through 3 or 4 ways. One is the program sustainability requires higher commitment of the government of Serbia. What is the important there? The government of Serbia declares and emphasizes its commitment to the sustainable development goals and universal health coverage, with no one will be left behind approach. Public health should become one of the priorities, like education, IT, and others. The government of Serbia need to recognize HIV prevention as a component of public health, human rights, mental health, and others. And one of the most, well, if we speak about option for the improving from other ways, there is one of the biggest legal barriers for involvement of the civil society in HIV response belong to 3 groups. One is health-related regulation, because we have a problem now. In Serbia, in our law of health system, civil society organization can be there. And we have a big problem with VCCT or other part of services. And we start advocacy for some kind of medical social services, because in that way, in Ministry of Social Affairs, we have part, and we can also do like medical social services. Also, one of the response is human rights related to punitive legislation. This is particularly related to needle exchange program and current criminalization of some of its activities. And financial legislation. I said that we have very strong law for civil society financing, and the current legislation allows only annual programs and projects. And our projects must finish in the end of year. And then in January or February, our ministry's open call, and we can, I don't know, sign a contract with ministry maybe in the best solution in the beginning of April. And we have a gap of 3 or 4 months. The most important thing is capacity building of Ministry of Health, civil society organizations, Institute of Public Health, and local governments, quality of data for quality of planning, improved communication and collaboration, sustainable financing, and allocative and technical efficiency. Next steps in sustainability It's proving governance and coordination of HIV response, prior optimization of RT, building supportive regulation and legal environment to civil society organization financing, engaging local governments and municipalities, and strategic information program data. Some results from that. A budget of Ministry of Health for period 2022-2025 will be around 800,000 euros. If we speak about price optimization, process start, and I think that we will have a working group for new guide in the end of this year. If we speak about local levels and municipalities, 10 cities signed Paris Declaration in the end of this year, and we start to develop the program of funding manual, etc., etc. I think that there is most important thing local level, because the local municipalities can get money for services. If we speak about quality of data for quality of planning, we finish IBBS this year, and we are waiting for results. And if we speak about legal barriers, the process of introducing civil society certification for the provision of services through the social protection system has been finalized. One organization from Serbia, Association Tuga, last 2 years piloting that project, that program, and I hope that in 2022, we will have accredited program for the whole process of medical social services. From my side, I think that I said what is important, and I think that I didn't disappoint my colleagues from Serbia, because the whole day spoke about socks of panelists, and I think that I also now have a socks for comments. Thank you.
Thank you, Goran. Я с честью представлю следующего выступающего.
I'm happy to present the next speaker. This is Dmitry Sherimbey, the leader of one of the largest patient organizations in the region. The experience of this organization is unique, because for it, systemic work with the state to revise the policies and practices, that's a strategic area. And I believe that this is one of the key priority areas, where the organization not just provides the services and provides support for the patients, but works on the systemic basis with the government in order to revise the laws and approaches within the country. So experience of Ukraine and systemic work, and the floor goes to Dmitry Sherimbey. Thank you so much, Maxim. All the nature of our discussion that we've been having throughout the day is characterized by the following. Structures, institutions that we ask to help us, and they may wait, they may not help. And I see an analogy, because this situation is absurd. And look, all of you should not be afraid of the situation where donors step back. Don't be afraid of that. Be afraid of that the policy of your states is not linked with actual situation, with actual life. This is what you should be afraid of, because you have children, you have people who you love, you live in the same building, and imagine that you don't have resources to buy bread or milk or medicines for your children, and you go to your neighbors. They understand your challenging situation, and they buy these medicines and the bread for you and milk. They do that today and tomorrow, they do that for 3 days, and then they notice that at the same time you buy a computer, a nice TV, and you do refurbishment in your apartment. Can you believe that? It cannot work like that. I mean, where someone consciously asks other people, neighbors, for help without providing for one's own basic needs, because that's not possible, right, in the real world. But I believe that here you recognize your fear. I also recognize my fear, and that's what I'm afraid of. You know, that life may be cheaper than fountains, beautiful parks, or some other stuff. That shouldn't be so in a normal society. The most catastrophic deficit in our region is about this unreasonable policy regarding human lives. Many years ago, we also were in that situation of choice, whether the donors would step back or not. We rather manipulated. We didn't revise our domestic policy. And over these 3 years, and I'm so grateful to all the experts and who were brave enough to implement 2050-80 strategy in Ukraine and to develop the market for procurement of services by the state. We were trying to change the infrastructure of the system, and that was the basis of the original grant, actually. But let me offer this straightforward advice. It is so important that the parents, above all, bought medicines for children. And if you don't have enough money for that, only then you go to your neighbors. For us, 100% life, that is the priority, the sense, and the objective. Life must be priority number one in the Ukrainian policy. And we are just raising the stakes. Narrow advocacy of one segment doesn't offer much unless you revise, you change the entire healthcare system. Imagine when charitable foundations are authors of the healthcare reform in Ukraine or revision of the procurement system, the drug policy, etc. We do not plan to wait for the future to come. We want to create this future here in our country so that our children survived, and we do not need favors. You know, so when you raise stakes at the state, when you request compliance with the straightforward WHO standards in implementing the financial policy in the state, everything starts changing. And I can show you the algorithm, what may change if you fight not for just one segment. We fight for all patients in Ukraine, for everyone who comes to hospitals. Why? Because, you know, light bulbs cannot be more expensive, more important than life. And that is why it is so important that many Ukrainian cities have started doing that without waiting for some transformation at the national level. They led by example. And look what can change over just 5 years if you systemically approach to working with the financial policy in the healthcare sector. You see, there is this standard. 5% of GDP should be allocated for healthcare, and this is stated by WHO as a minimum that the state needs to comply with. And look, until the 2013, it was a castrated healthcare system. It was $2 billion for Ukraine, for the entire population of Ukraine. And what started changing when we claimed that life must be priority number one and all counterparts in Ukraine came together? You see that figures start changing dramatically, like threefold, from 50 billion to 162 billion. If I'm happy with what I see, well, I like it. However, we want to see the figure 300 billion. This is 5% of Ukrainian GDP. Why that's important? Because there is a pressure of resources and the consequences of that. How that transforms into all the programs, healthcare programs for oncology, for TB, for just everything, for orphan diseases. Well, look, if your government or our government spent 4 billion to procure all kinds of medicines, in a year it spends 6, then 7, then 8, and then 9.
So it means that all the programs grow twofold every year. So you see that in children's cancers, like there's a twofold increase, like testing programs are covered, and we are talking about 36 health-related programs in Ukraine which changed, not just in the sphere of HIV. So we're talking about more global changes. How does it influence us as patients? So you can see such a high increase at a certain time when the government provided a very high amount of money. There was a twofold deficit of money for to cover HIV drugs, and so the country, I mean in Ukraine, where we have the pandemic and the armed conflict, still there is money for that. And when also the policies change and generic drugs become available, that is also important in terms of resources. So finally, we see that money are enrolled into treatment. If we saw like the 20-year statistics, that would be like more or less flat, and here you see a 20% increase per year. So all that is needed is resources with responsible policies. And like post-tsunami situation in Ukraine, we have public procurement market. So market where services of NGOs are procured. So of course we have a goal to scale up this market. So I gave you this analogy for you to understand clearly that you cannot be asking for support when people have a right to live. That is their most fundamental right. And unfortunately, this right sometimes should be implemented urgently because people have their relatives dying, and that is not fine. We are uncomfortable in Ukraine, our organization, and we do not plan to be comfortable. For us, the main indicator is the number of people who survive due to our activities, and the funding policies should have a clear system of values for every country, not just Ukraine, and life for us will always be priority number one. And the last thing I want to say, that is kind of an announcement. The strategy that we will suggest to Ukraine, and we have consultations now, so we hope that it will be implemented. So we want to shift the borders of responsibility. Every mayor, every governor most often thinks that the Minister of Health should deal with the health issue, or President or Prime Minister. And Ukraine is an important example. We have exceptions from this rule. We have such cities as Kiev, Poltava, Lviv, and they have different trends. So those cities, they take the responsibility and they work on resolving the problems. We want Ukraine to implement plus 100% strategy. We want every city to allocate plus 100% to the funding invested by donors. It's like when the neighbor honestly declares that he hasn't got money, but if neighbors help him, then he should invest at least $1 per every dollar which is given to him. We have this goal for the coming years, and we have a lot of courage to achieve this goal. For us, life is the basic value, and that is not a programmatic term. It's not an audited term because it is difficult to report on it, but that is why we're able to change the situation, and we will continue these changes. And I want all people from this forum and listening to us to clearly understand that as long as in our countries like movie theaters or parades are more important than lives, we will not think about the deficit of funding but about lost lives. And that is the terrible number that is a consequence of such a corrupted and false government policy when the government says that good roads are more important than people's lives. I represent a patients organization, so I realize that I've got a huge number of reasons to speak like that. And of course, I would like to have good roads, and I want to see good buildings in my city, but I don't want to have the roads at the cost of lives. So I want the standard package of services to be of a higher priority than the road. So I hope that the Association of the Cities of Ukraine will be the leaders in this process, and mayors will take the responsibility for the lives of people in their cities. Then we will be able to move forward in implementing those goals to make sure that policies are focused on lives. Yeah, it was specially done that we will have Dmitry as the last speaker, because we know that he is capable of inspiring people. Thank you, Dmitry, and I would like to thank again to all the speakers for sharing your experience, for your presentations. Thank you a lot. And considering that we started later, we are kind of okay with the timing, so please stay here, don't leave. I wanted to make a number of conclusions, going back to each presentation. First, we need to clearly understand that our goals, they are clear. We want HIV services to be part of government policies, so that we have government allocations, and so that we do not have to prove that such services are necessary every year. And we need to have systematic approach. That is very important. And we need to understand that we cannot start and finish this process within 3 years of grant implementation. So this is something where we take responsibilities and work together with the government for years ahead. And we need to understand that changing just one system and preparing a public procurement mechanism, that is not a sustainable model, because we need to look at it from a comprehensive point of view, like how the government cooperates with civil society. Does it see CSOs as service providers? If there are mechanisms of procurement of services, if they are adjusted to the third sector. And Dmitry actually said an important thing. He said that we need to remember that we need to increase funding, but at the same time, we cannot only get more money for HIV/AIDS within the same health budget. It will mean taking money from some other health sphere. We need to have sufficient health budget to cover all the needs in public health. That is a quite challenging task, but this is what we need to strive for. We need to understand that it is just not possible to have increased funding for transition plan, not adjusting the health budget, not bringing it up to 4 or 5%. Those are the conclusions and the goals which we see for all the countries. And yeah, we have a lot of good results, and we would like to say a big thank you to all our partners, experts, donors, but also we have a lot of things to do in the coming years. So I wish you all good luck, and I wish you patience, new cases, new ideas. I would like to thank our speakers again, and let us move forward. Thank you all. Maxim Demchenko, Roman Drost, Ruslan Paverga, Georgi Saselya, Goran Radislavovich, and Dmitro Sherimbey. Thank you for this panel discussion. So, dear friends, I would like to remind you that such a big forum was organized by Alliance for Public Health, SOS Project Consortium, and the partners of the regional project from 14 countries, and the information partner is UNAIDS. And We would like to thank also the Global Fund for AIDS, Tuberculosis and Malaria for financial support of this forum. And now we move forward, and one of the most important achievements in the period of project implementation is reducing prices for antiretroviral drugs for HIV treatment. And the results that our speakers will present, they are backed with the thorough work of many people. And it makes a huge difference for the key population. So our next panel discussion is reducing prices for antiretroviral drugs in the EECA region. So I am happy to invite the moderator of the session, Denis Godlevsky, ITPC, Russian Federation. Hello. And with your permission, so our panelist, Sergei Dmitriev, international expert on public health and budget advocacy. Ludmila Maestat, medicine's patent pool, Switzerland. Alexei Mikhailov, ITPC, Russian Federation. Also, we will have with us Aida Kurtovich, Partnerships in Health, Bosnia and Herzegovina, and Andrei Senih, Stronger Together, North Macedonia, and Aybar Sultangaziev, Partnership Network Association, Kyrgyzstan. So, Denis, the floor is yours. Colleagues, I have quite a challenging mission. I hope that you all use your smartphones because you are writing us questions online and making comments and making reposts on Facebook from this forum. That is good, of course, but I want to follow our timing, so I am sorry, dear colleagues. I love you all, but today I will have to be kind of a watchdog, so I will ask you to speak for 5 minutes, like each speaker. And very quickly, I want again to say thank you to organizers for this opportunity to share our the results of our activities for the recent 3 years, and I hope that our meeting will be quite interactive. For the first time, it's such a big forum with the big representation, so I hope that it is the end of the era of COVID and it is the start of post-COVID era. So let us welcome our speakers. Thank you that you're still alive and that you're following us. So, as I have mentioned, we will talk about reducing prices for antiretroviral drugs. I think that people who are here with us in this room, they know that this work is very important. It is direct investment into saving lives of people today, not tomorrow, but it is about survival of people today. Because without this work, we would have bigger mortality from AIDS. So without further ado, let us give the floor to our participants and panelists. So the first one is Sergei Dmitriev, international expert for quite a long time on policy and advocacy, who in the recent years was leading this area in 100% network, and now he works at a different level already. So the floor is yours, Sergei. Thank you for such an introduction. Actually, we are all international experts here, right? Because we cooperate with one another and country to country. We share the practices that we develop with the others. So we are all international experts. And yeah, for 3 years, in cooperation with Alliance for Public Health in the consortium, together with you, we have been working on access to treatment. So how can I change slides? We should have a remote control somewhere. Maxim, maybe you took the remote control with you. Oh, here it is. Okay. So here we go. And I think that that's how you change slides. Yeah, the green button. Yep. So this slide shows the cycle of procurement, and in green you can see the priorities that we started using in the region. So you can see that here we have diagnostics and treatment guidelines. That is the start of the cycle. Then selection of drugs, demand forecasting. So forecasting the demand for the country or for the region. Then we have the procurement process, logistics and storage, and the final stages are consumption and monitoring and evaluation. So as for the next stages, we plan to cover also the next components. So currently we will just speak about those three components in green, and I will tell you what we did together with the partners, and there is a case, one of many, which I would like to focus on. Diagnostics and treatment guidelines. It is important that communities in this project made a review of the guidelines in EECA countries to see if those national guidelines comply with the recent WHO recommendations, how they are synchronized. And we did this review by the members of community. So with your mentorship of ITPC RU, in cooperation with all other partners in the region. And further, we discussed the results with the WHO Europe. So we had the clinicians which were interested in advocacy activities, and together with the WHO representatives, we had meetings where we defined the advocacy strategy. So that in the countries where such guidelines are not synchronized, to update them. So what I would like to point out is Kazakhstan, Kyrgyzstan, Russian Federation. As Russian Federation, I'm not saying anything about politics here. Just sorry. So Kazakhstan, Kyrgyzstan, and the Russian Federation were the countries covered in 2020, and now we work on finalizing guidelines in Belarus with the engagement of communities, and we hope that finally we will get the kind of perfect guidelines recommended by the WHO with dolutegravir and efavirenz 400. So actually the results that we got in those countries, they make us happy. I wanted to say also that together with the WHO and Central Asian Association of People Living with HIV, we had a good synergy in providing training and on how WHO recommendations can be implemented in our region. So together with Alliance, the network, and the WHO Europe, so we had training for community members and clinicians in the region. So that's what we did together with you and the ICAT platform. So you're really professional there, and so together with you, I think that we had 9, I think, meetings with all producers of original and generic drugs, and also distributors and MPP and the procurement agency. So that was a big platform, and it was all done in the context of international agencies and patients from our region. So when we talk about the stage of selection of drugs, there are a lot of things with Belarus and Kazakhstan. The achievement is that we have countries with the income above average, with the registered of generic dolutegravir, and in all negotiations with pharma companies, community members were involved. So they were present at the same meetings with MPP and the ministries of health. It also increases the level of advocacy capacity of community organizations. And we have generic access to generics now, and the participation in planning and registration of generic drugs in the countries. That is all done with the observation or with the leadership of communities.
Price reduction in each grant, there are indicators apart from political ones and systemic change. There are indicators, and whether the grant achieved these indicators by the midterm, and mostly it is $130 of the annual first line treatment course, DFFTC equivalence, that has been achieved apart from Belarus, where at that time there were this problems, and it was quite difficult to influence the prices of the products because of the political turmoil in the country. And the indicators have been met. You see 119 million saved on the procurement. A lot of this money stayed within AIDS programs to procure tests or the consumables for HIV infection or prevention programs. So the main objective of the project has been implemented. And briefly, not to take all of your time, I would like to mention a case which is an best practice. This is where the Позитивная Initiativa community in Moldova interfered into procurement cycle and suspended the procurement process because they detected extra expenditures on the part of the government for the products. So they suspended the procurement process, they revised the TOR and involved generic producers, and as a result, due to this active standpoint of the patient community, they saved 21% of all the entire budget for HIV. So $30,000 was saved by the country due to the communities, and it was redistributed for those needs within the HIV program. So this is the saving, as I mentioned, and the procurement. Very briefly, actually, we analyzed the procurement system in all the countries. And in the procurement cycle, actually, we see that now there are very promising achievements by the communities where directly with procurement agencies, they develop the policy and streamline the procurement system and involve unregistered products, and thus they create significant competition in ART market, and that results in significant savings. Thank you so much. Thank you, colleagues, and let me remind you that you can ask questions online, and I hope that we will have 5 or 10 minutes at the end so that we could discuss those and you could ask questions to our speakers. Sergei, just one question, not to transform our session into the session of mutual expression of gratitude and reporting on success. So, considering all the work that has been implemented, what do you believe is a challenge, the problem that needs to be addressed next as a priority? Maybe one or two. I don't want to focus on a single issue. I would maybe come up with the recommendation. The main thing for our region is synergy, joining efforts of all the partners in order to develop the respective targets, objectives, and not always we succeeded. This could be a problem. I mean, not everyone who could join the targets for access to treatment and respect for human rights, not always all the stakeholders are involved. So maybe in the next years we need to work on the synergy, on the partnership, because that from time to time appears as a challenge. I wouldn't say that it is an overall challenge. But this is something we need to address in the future. Okay, colleagues, the next participant unfortunately was not able to join us. That is why she recorded a video message. Ludmila Maistat, you know her very well. She's now in Switzerland, in Geneva. She works at the medicine patent pool. And let's hear her. Dear colleagues, dear partners, thank you very much for the opportunity to participate in today's forum. I'm going to speak about improved access to vitally important programs via medicine patent pool that is targeted to public health. Since the scope of the pool is quite extensive and our mandate goes beyond HIV, hepatitis, and TB, I will focus on 3 items. Very briefly about how our licenses work, then we will consider a case study on dolutegravir, and we will speak about fresh new licenses for COVID-19 treatment. And we will start with the first item, how we provide for countries access to medicines. Most of the medicines, especially, so they are patented. It means that countries can produce from the same producer, the holder or the originator. You cannot procure generics because of the patent, and since there is no competition in the market, the price remains high. As a result, most people who need treatment do not have access to that treatment. There are only 3 scenarios where it is possible to procure a generic. First, where there is no patent, where it has expired or challenged, and where licenses are issued for generic producers for them to produce this medicine. Let me briefly remind you that medicine patent pool was created by UNITEC at the support of WHO and UN in order to ensure access to generic medicines for HIV and TB. We expanded our mandate in order to cover all vitally important products, and upon the request of WHO and other stakeholders, we started recently working in COVID-19 area too. The model is quite straightforward. We are in the center of the model, and we conduct negotiations. We sign license agreements with holders of the patents, with the producers of original medications. Then we sub-license generic companies so that they could produce and supply the formulas and the combinations and the products to low and middle income countries. We provide usually licenses for several producers in order to ensure competition. This is how generic medications come to most of the countries. Very often countries do not know why they now have this opportunity to procure generics. But the true problem is where there are licenses and countries just don't know that they can procure generics. It's important that our licenses are guided by public health needs. They are transparent. They are fully published on the website, on our website, with the focus on expanded access, non-exclusive provisions. We work with a range of generic companies, and at the same time, we select them according to a procedure to ensure WHO pre-qualification. In this way, we ensure the quality. The licenses are voluntary and complementary with other access strategies. Currently, 148 countries receive WHO qualified generics under our license. 16 billion dosages of treatment have been provided. International community has saved more than $900 million due to MPP licenses. Dolutegravir license is one of case studies how our license agreement works. Currently, generic dolutegravir is procured by 113 countries. 98% of the region's population live in those countries. The license makes it possible for the countries to receive the combinations that are procured by 96 countries, where 98% of people living with HIV reside. Cumulatively, about 500 packages of TMD and 26 million packages of dolutegravir has been procured since 2017 via MPP licenses. In our region, as of June 2021, about 4 million packages of generic dolutegravir and TMD have been procured, and the figure is increasing. As you know, based on our previous discussions, at the end of last year, another license for dolutegravir has been signed for countries with higher than average countries. Azerbaijan, Belarus, and Kazakhstan were covered. As a result of strict selection, 3 generic companies were selected. Azerbaijan and Belarus have already started procuring dolutegravir in 2021, in June and August, and they plan further procurements for 2021, and Kazakhstan is planning procurement for 2022. Very important role in signing the licenses and implementing it is played by civil society support, and that's many of you in this forum. We also work with governments, other stakeholders, WHO, UNAIDS, Global Fund, UNICEF, UNDP, and a range of others. And the last item is our activities in the field of COVID-19. Currently, WHO has not recommended new products for treatment of COVID-19. However, recent trials of 2 antivirals show significant effect, reduction of hospitalization rates for adult population, especially high-risk groups, and reduced mortality. These are BF and Pfizer products. Recently, we issued licenses for both products so that countries could procure high-quality generics. And more than 4 billion of population have been covered, and 95 territories received the licenses for Pfizer product, and this is more than 4 billion of people. Both licenses make it possible to produce the products in any country of the world, and no royalties apply. So no payments to the originator are made. So this is available for countries where there are no violations of patent law, and the licenses are transparent. They are published on our website, including the lists of countries covered by the licenses. Several frequently asked questions, for example, when will generics be accessible for treatment of COVID-19? We have already announced a competition for producers for both products, and at the beginning of next year, we are planning to publish the list of these generic companies, and access in the countries will depend on the rates of production and regulatory processes in the countries, how long it will take to register. And it is important to note that the products will be WHO pre-qualified, so they will apply a WHO procedure, and that will be fast-track procedure. Maybe one of the most important questions: how is it possible for countries to procure these treatments for COVID? Countries are supposed to directly contact generic producers. The list will be published on the website, and do contact me if you do not see this list anytime soon, or it's possible to go via procurement agencies, UNICEF, UNDP, others. It depends on the country's choice. And MPP does not participate in procurement procedures, but we publish the whole range of information, so follow our publications. And also, as far as we know, there may be opportunities for countries to procure these products with donor support, and there you can directly contact donors. Thank you for your attention and for cooperation. Thank you. It is a little bit unfair. Those who have come here, I will have to limit your time for presentations, but here, okay. Anyway, we go on. Thank you, Ludmila, and I hope that we will have some questions about MPP, and we will pass them over or discuss them here. And now let's go on. The work that has been done by the colleagues and my colleague who I'm going to now introduce. This is Alexey Mikhailov in our organization. He is head of the department to interact with public authorities and pharmaceutical companies. So, Alexey, please tell us about what has been happening in the recent 3 years as you see that. Hello. I will try to fit into those 4.5 minutes, not 5, not to take 5. Okay. The first slide is rather an introduction of our organization. We have been monitoring procurements for more than 10 years, and we've undergone a lot of problems. So in Russian Federation, that was about centralization, procurement, decentralization of procurement processes, more than 4,000 auctions a year. And after the Russian Federation, we switched to the region because there were queries from country partners, counterparts. We passed over that experience further to the countries, and we believe that this work is ongoing. Somewhere we are involved, somewhere we are not, but people continue following what's happening to prices, to the scope, volumes, and nomenclature, etc. We tried to monitor prevention a little bit, but happily we decided not to go there. Now speaking about the figures, these figures mostly apply to Russia, but there will be some regional figures too. This is the budget. The budget, actually, if you consider rubles, amount in rubles, it is growing. However, there are the exchange rate related issues. So in 2021 it was a bit higher, and they promised that in 2022 it will be even higher. But again, as we discussed in the previous session, we need to keep in mind that the budget that is available for HIV treatment in the Russian Federation is not sufficient, even if you consider various indicators, as Dmitry mentioned, no matter whether these are data of the Ministry of Health or Rospotrebnadzor agency, that won't be enough to cover even 80% of people living with HIV. However, we can see that treatment coverage is growing quite steadily. These are our data. These are procurement data. These are full courses for a year, for 12 months. We have data of the Ministry of Health, according to which in the Russian Federation there are about 600,000 people in the course of treatment. But they believe that if somebody receives treatment at least once, that they continue with the treatment. This is the premise. So this is what we have already discussed a bit earlier. This is about the total savings in 2019-2020. We don't yet have figures for this year. This is about $115 million saved in the first 2 years of implementing the project. I don't know what I could add there. Well, actually, maybe we should revise the formula, and we should keep in mind the reduction of the price for a specific product, not the total based on the number of people in treatment and the total budget. What's the problem? Why do you believe it is important to do that, to analyze that for each product separately? Well, you didn't wait for the discussion to start. Okay, so we measure the average temperature, so to say, in hospital, in this way. Because this year we signed a 3-year contract for dolutegravir, and the price was significantly lower, or other products where we had the same approach. So it would be more adequate to analyze that on the product-by-product basis, because for tenofovir, for example, that is 150 rubles, you cannot go lower, but it is procured for every patient.
So looking at this price would not be correct, because just reduction in this case is not possible. So we need to look at the drugs which are still under patent or where we just started price reduction. I think it would be right. So that is about the prices in the regions. So I showed this slide in Bishkek and I brought it here. So that is was done in also with another project, but what I wanted to show is Kazakhstan. So unfortunately for Kazakhstan we have restricted data on prices, and that is where we really need to keep an eye on the situation, because in the Russian Federation currently, well, not officially but maybe unofficially, there are suggestions also to close data on prices within a long-term contract. Of course, we will resist to that because we are trying to take the best experience of Europe, but in this case, it's like definitely not best practices, because otherwise that will be an area for corruption. And if we talk about prices, we see that there are some discrepancies here, because there are different procurement mechanisms. Like if we look, for example, at atazanavir, which in Russia costs fewer within public procurement than the price in Kyrgyzstan within the GF procurement. So we were looking for the lowest price here, and the price in Russia was quite good in these terms. That is about the diagnostics. So we are monitoring diagnostics with our partners in the countries, and it brings results in individual countries, and people start thinking like how much does diagnostics cost, especially during the COVID pandemic. People look even more at this issue, because in the Russian Federation often there are many COVID tests, but not tests for CD4 viral load and drug resistance. And I can really speak a lot about diagnostics, so maybe in future we could have a separate session and talk in more detail about those aspects where we have problems, because I think that actually here we have more problems than with ARVs. So that is what Sergei mentioned about the Eurasian Community for Access to Treatment. So we had here meetings also at the national level. We with all pharmaceutical companies, and this year also we had a site visit or like a study tour to a pharmaceutical factory, and we showed that actually medicines are produced at quite contemporary equipment, not some old equipment. And these are recommendations. So as for diagnostics, we need to continue working on reducing the prices there, so that the government can feel this pressure, and so that we remain partners for them to improve the situation in the countries. Thank you, Alexei. So I already asked a question to you. I have a little remark to support what Alexei said about the long-term direct contracts with the pharmaceutical companies. I would like to say that in those contracts, we can see that prices are reduced in this case not so quickly as compared to the situation when there are tenders and when we can get involved in those tenders and make some impact on it. So long-term contracts is quite a challenging thing, not maybe a good one for the region. Yeah, but I would like to comment on that because we had long-term contracts on patent drugs, where patent rights will remain for the coming years. So there would now be no competition there. But the fact that we could reduce prices even more, that is a fact. I'm speaking more not about Russia, but about the region as a whole. Colleagues, I think that in the regional context, it is important here to focus on our governments and the regulators not to sign contracts for long-term contracts for the drugs where we can have compulsory licenses or voluntary licenses, or when patent rights exhaust like next year and the government is signing like a long-term contract. That's not good. And I will now switch to English to present our next speaker.
To introduce our next participant, who is a truly not just regional but global health leader. I am not going to state all the boards and all the positions you held in various boards during your 2 decades of serving in public health. It's my great pleasure to give the floor to Ms. Aida Kurtovic.
Thank you so much. So can you hear me well? So, yeah, it's great to be here today, and let me first to challenge this group a little bit. Gender balance of this team. I hope next time when we speak, we will have more females on board here. And the previous panel was also a little bit challenging, so I really have to react. I will stay within my 5 minutes, and I will be taking you through the slides very quickly, but my presentation is really not about slides. So it is about initiative for the reduction of the price of antiretroviral drugs in Southeastern Europe, which is often called Balkans. One word about this region. Usually we are being recognized or perceived as an area, as a region where it is tough or difficult to work. But actually, these are the number of countries that have been on and off from the international support. And countries like my country, Bosnia and Herzegovina, which is no longer eligible for the support of the Global Fund. Serbia has been there before, eligible, non-eligible, Montenegro as well, Macedonia, North Macedonia. So we are working in the challenging environment where you have no CCM, no national grant in Bosnia right now. In Serbia, yes, you have it, but it's not any more significant as it used to be, or in Montenegro as well. So recognizing all the challenges which are coming hand in hand with political challenges of our region are making this environment really difficult. Why I'm saying that? I'm calling for the entire room to learn the lesson from our experience, which is tough, which is really tough when you fall off the cliff and there is no safe network to support you. You are just losing the HIV prevention services and services for the key affected populations. It's not about civil society staying without funding. It is about key affected population, people in need, who need the service, but it's not there anymore. So that was our environment when we started this project implementation 3 years ago, and this specific initiative has started some 18 months ago, so even less than that. And I must honestly thank colleagues from the 100% Life and the Alliance for Public Health for raising this issue, because we were not aware, and we are still finding it difficult to understand how different prices are in some of the countries of Eastern Europe and Central Asia compared to prices in Southeastern Europe. So some drugs which can be found for $4 in our region do go as high as nearly 600 euros. So incredible, incredible difference. In the same time, I'm going back to the context, you are in the situation where you do not have funding from the government for services for the key affected populations. So we started discussion, and with 100% Life and the Alliance for Public Health, we conducted a regional review and basically did the mapping on access to treatment and also pricing. And then we faced a couple of challenges. So there are discussions and there are different arguments on the value of brand and generic drugs. We are not advocating for any specific drug. We are not in that position. But we are advocating for the treatment of good quality, which is accessible to all people who need it, regardless of where they live, what is the nationality, and so on. So we started from our own country, from my country in Bosnia, and we have reported all these challenges. So basically, the small fragmented market, low competition, then long registration processes, high prices, and so on. So the report is up on the web. I will not go through it. It is a great report. I would encourage you to read because it does bring forward a number of challenges to your attention. So please go and read. But what I want to say is that only within 18 months, by starting to do this process, doing the review and everything, we have not only raised awareness about the challenge that people honestly were not aware of, and we found it hard to believe that it could be so different. We have also managed to revise clinical treatment guidelines for treatment of the HIV and AIDS in Bosnia and Herzegovina. So I want to thank my Federal Ministry of Health sitting back there for approving it 2 days ago, and I'm looking forward to more good news next week on that. But we also opened the regional dialogue, which I find really important. And we got at the regional meeting this summer in Montenegro political commitment from our decision makers that we will follow and we will continue exploring ways, different ways, how to negotiate with producers to find better way to fund antiretroviral drug. What I also have to mention is that there are good stories in the region, like North Macedonia, and each of the governments in our small sub-region has strengths. So there is really good intention and good commitment to make things better. Serbia has an impressive list of drugs which is available. Bosnia and Herzegovina has completely reformed in past 18 months the process of procurement of drugs. So it is now centralized and people are not subject to discrimination on the basis of place of residence. So it is all kind of side effects of this initiative, but we are really in need for continuation and we need more. And yes, we will be facing different challenges. Yes, there is COVID pandemics, but it's never going to be easy. And now it's time to act really. So thank you, I'm aware of time. Thank you so much, and I'm looking forward to your questions.
Спасибо большое. Thank you, Aida. I will ask you one question from your experience both as implementer and also in your position as the member of the Global Fund Board and delegation. These questions, like access to medications, especially in European Union, they are often related to intellectual property issues and also the market accessibility and market rules and regulations. Do you think there is more space in the Global Fund agenda to talk about these things, to support work with this regard? Do you think this should be more of the issue for the Global Fund, or do you think it's already sufficient, and what should be done in addition?
I think, yeah, can you hear me? Yeah. So, yeah, the Global Fund is important global actor. So, Eastern Europe, Central Asia is kind of front runner in transitioning from the international support towards the domestic financing. So I think whatever Global Fund does for our region, it does it also for the globe subsequently. So I believe it is an initiative worth exploring and opening discussion because from our experience, as long as we keep it only at the regional level or national level, it's so much harder to move and achieve. So Global Fund is kind of unique partnership that brings many partners together, but it also has huge leverage on these partners, on countries, on pharmaceutical companies, and so on. So I would say, why not?
Okay, thank you so much. So let's move to our next speaker. I'm very happy to introduce one of my also dearest colleagues from North Macedonia, Andrei Senih, who is the director, correct me if I'm wrong, of the organization Stronger Together, and he's also the member of European AIDS Treatment Group for many years. His organization is doing work not just on the access to antiretroviral medicines, but also on the epidemiology, access for services to key populations, and many more. Andrei, the floor is yours.
Thank you. Thank you, Denis. Thank you for inviting me here to speak about a very specific example of what can be done, maybe in a country in Southeastern Europe, with a very small epidemic where the context is completely different than other countries from Eastern Europe and Central Asia. But still, there are opportunities that can be used. Let me first see how this functions. Okay. So in order for us to understand the context, let me say that we are talking about a very low-level epidemic in North Macedonia, with, at the end of 2020, only about 300 people receiving treatment, who represented at that time approximately 60 to 65% of the total estimated number of people living with HIV in the country. When it comes to ARVs, the funding for their provision comes not through the national health insurance, but through the separate national HIV program, which is both a treatment and prevention program. And they're procured through an annual tender announced by the single institution providing care for people with HIV, that's the Clinic for Infectious Diseases. A number of challenges are related to the low number of patients. First of all, I can mention the lack of interest among companies to register their products, which increases the uncertainty and the lack of predictability of procurement procedures. The low quantities of procured ARVs also lead to very often to high prices, even for generic medicines, especially when there is no competition. So having a generic product is not a guarantee that the price will be low unless you have competition. And there are also inadequate, I would say, inadequate budgeting practices. Just to give an example, the budget for ARVs had not increased for 3 years in a row by the end of 2020, whereas the number of patients within that same period had increased by 50%. So that put a huge stretch on the options that the clinic had to conduct the annual procurement in 2021. So these are just to have an idea of what prices are, the cost for ARVs are. So the average cost per patient per year is about 1,900 euros. But this means that slightly more than 50% of patients are actually taking one of the cheapest regimens. That's tenofovir, disoproxil, emtricitabine, and efavirenz of 600 milligrams, which costs 328 euros per patient per year. On the other hand, the principal recommended regimen and drug by WHO guidelines, dolutegravir within triple combinations, has an extremely high cost, as you can see, of more than 5,000 euros per patient per year. What we tried to do through within the framework of the SOS project, with huge support from 100% Life, the technical support and expertise, was to focus on increasing the availability and scaling up the use of dolutegravir for patients in North Macedonia. We did patent inquiry. It wasn't very easy to identify the exact patent landscape for North Macedonia, but eventually we did identify clear obstacles related to patents of procuring generic dolutegravir. We did establish communication with generic producers as well in this process. In the end, we just resorted to writing to ViiV Healthcare as the patent holder. Basically, we had the National HIV Coordinator as a Ministry of Health official send a letter with the support that we provided and to request, first of all, clarification of the patent situation, and second, some kind of patent exemption, whether it be a voluntary license or just providing a statement that they would not enforce their patent rights. The response that we received after several attempts was that, well, the patent situation remained unclear. It wasn't a very clear response regarding the patents, and also regarding the patent exemption, the answer was no. Basically, their position was trying to be kind. Of course, their position was that, I'm paraphrasing, but basically that every country, according to its level of income and so on, has an obligation to contribute to the funding of innovation and so on, the general storyline, of course. However, through this process, they did offer some discount, which in the end proved crucial and enabled the Clinic for Infectious Diseases to actually provide sufficient quantities of medicines for the current year. I'm talking about 2021. So you can see basically the price of abacavir, lamivudine, and dolutegravir dropped from 5,347 to 4,607 euros per patient per year, and also the two-drug regimen with TDF FTC dropped to 4,845 euros. It's not a lot, and it just I think opens us to the thought that we should get more engaging with actors, with patent holders, but also with generic producers and with the institutions. We intend to continue strategizing, and we actually intend to go back again to VIV with another request, basically trying to raise the issue of their different pricing strategies in countries that are supposedly fall in the same category, for example, upper middle income countries, and they still have very different pricing strategies. And so we will see. Another direction that we are intending to explore and to try is increased patient monitoring in the country of these processes. We have been doing this for a year, but with limited capacities, I must say. And also something which has probably not been done very often in our region is putting patients, responsible institutions, Ministry of Health in the first place, and pharmaceutical industry on the same table to discuss these things. Yeah, thank you.
Thank you, Andrei. Спасибо. Очень короткий вопрос. Is there any request from other countries in your region or maybe beyond about you using this experience of non-enforcing the patent and writing to the company? Because for those countries who are not strong enough politically maybe to issue compulsory licenses or take other steps, this might be also an option to proceed to drop the prices. So was there any request from others?
Well, so far, no, because I think the experience is relatively fresh, and this is actually probably the first time, or maybe we spoke briefly in Budva a couple of months ago as well. But yeah, these are the first discussions, and I think they should be scaled up more broadly. It's not, look, this is not a philosophy, it's just an issue of starting to deal with these issues, starting to monitor, and starting to engage, and basically repeat your demands to those who can make a difference.
Спасибо большое, Андрей. Коллеги, ну, на мой взгляд, это один из таких действительно интересных механизмов.
I believe this is one of key mechanisms, interesting mechanisms that can be used, so you can contact Andrei and ask questions about the experience. But now let's move to Central Asia, and the last but not the least, definitely, in all the processes that happen in the region. Participant, this is a head of the Partnership Network Association in Kyrgyzstan, Aybar Sultangiziev. Well, this is the country where the voice of civil society can be heard very well in all the processes that are associated with HIV infection and reduction of prices, to a great extent due to your work. So now the floor goes to you. Thank you. Thank you, Denise. And I'm happy to welcome you. I understand that I have very limited time. I see the monitor and the seconds are making me nervous. However, if we speak about price reduction, well, there were several principles in our approach. First, it is that our citizens need to have access to the best products. 5 or 6 years ago, when we compared the protocols, we could see what they suggest in Europe and what they offer to us, even WHO, what they offer to us here, that made us angry, you know. And then the task was to make sure that our citizens have access to better quality medication. That was the first principle. The second one, it is that those products were supposed to be inexpensive because we are not a very rich country. And the third thing, well, now we speak a lot about patent law, about legislation in this area, but I believe that all the laws were developed involving the pharmaceutical business lobby in order for these companies to generate maximum profit. And maybe that is why pharmaceutical companies are kind of using us, our citizens, and budgets of our country. So we also should proceed based on this kind of business interests. On this slide, we show how we try to expand the competition to the extent possible. And over these 3 or 4 years now, as you can see, we have 50 ARVs registered, 26 combined, which make it possible to select among pharmaceutical companies. About 80% of them are WHO pre-qualified products. Last year, Russian businesses started entering the market because the policy is changing, but that's a different topic, and that is quite a pain point. The first steps undertaken were about expanding the competition and the number of products in the market, but there were different approaches to that. Our clinical protocols, the clinical guidelines have been revised on the annual basis. It happens very dynamically, and we try to the extent possible to include the best products. Now we have included even those that have not yet been recommended by WHO because they are available in Europe, but for us they are kind of expensive, tough. But us, we've included them in the guidelines and we've registered, and this product like tough, and now it's possible to procure it. So there are a lot of negotiations. We had supported by 100% Life. We had negotiations with pharmaceutical companies, and we have 4,500 people on therapy, and we thought that we are not attractive for pharmaceutical businesses because the market is small, but it appears that we are interesting, and we have quite high competition in the market now when the companies, even chasing this rather moderate profit, like $500,000, they are ready to compete for that. It was important to create a competitive environment for them because the corruption threat at the stage of registration is relevant. We monitored the entire process, starting from submitting the dossier for registration. We made sure that everything happened transparently within the timelines. We provided access to all the companies if they are WHO pre-qualified to make sure that they followed the simplified procedure. So it was possible to have registration after 45 days already. Unfortunately, since July, this is no longer an option. And of course, in the process of procurement, there were negotiations because there were attempts to create unfair conditions for certain companies. What else happened? This aspect of setting the price cap. Well, when we talked to the aid center, when we analyzed the market and showed them what prices can be observed in the market, minimum prices, it's interesting that the reference price was the price of the Global Fund and UNDP that made the procurements under Global Fund grant. And now, Global Fund, UNDP competes with Aid Center who sets a lower price. That's a very interesting case, by the way, this kind of competition, when the competition is already with international organizations. And of course, monitoring of procurement process, enhancing competition among procuring entities. And this is what we had and what we have now. 15.5, they offered the price of 24 when there was just one company in the market, but we convinced them to set the price of 15, and when next year there were already 3 companies in the market registered, the price collapsed to 7.8. This is public procurement. For UNDP competes with the aid center, and in the same year they already set the price of a bit more than $5. So we don't know if it can go lower. This is same figures for hepatitis C treatment. It's interesting that these figures, 900 and 453, it was 900 because on that year only one company was registered when the procurement was made in January. But next year, a competitor, even 2 competitors came to the market with the Glatasphere. So when there were additional producers, the price collapsed, but we didn't buy it then because this year we procured Viltapasphere, Sofosbuvir, for 453. But even there, we didn't stop there. Next year, Viltapasphere was already, there were 3 offers in the market. And eventually, we got the price of $246. These are the prices that we have. So, briefly, even though we have only 4,500 patients on therapy, about $700,000 we saved over these 2 years. And I believe that if you multiply that by the number of citizens in your countries, where you have 100 times more people, well, you would see these figures. Great, and thank you so much. For those who just start following this path that you have already managed to implement, maybe some advice, just a very brief tip, piece of advice. You know, actually, you need to be guided not by the legislative framework, because one guy came from Global Fund and they said these are rules of the Global Fund. I mean, they were not human-centric. And then I said, then you need to adapt the rules if they are not helpful for the country and for people. I mean, you need to adapt rules to make them human-centric, human-friendly. That's a great summary, and thank you, colleagues. Unfortunately, we have no time for questions. Denis Godlevsky, today we've discussed reduced prices for ART in EECA, and let's once again welcome Sergei Dmitriev, Lyudmila Maestrak, Alexey Mikhailov, Aida Kuprievich, Andrei Sinek, and Aybar Santalgaziev. Thank you so much for this panel discussion. And now, dear friends, unfortunately, the timing is strict. It cannot be adopted. That is why we have only 7 minutes for a short coffee break. So at 5 Istanbul time, we expect you here for the 4th panel discussion. They are going to be as interesting. We will try and surprise you with new formats. So at 5 straight.
Ну что ж, дорогие друзья, рада...
So, dear friends, I'm happy to welcome you again here in this audience and to welcome all of those who follow us online, and thank you for staying with us. And I see these heroes who are so committed, so engaged, and they are really participating actively. Now, what's going to happen now? This session that we are going to have now, it is focused on respect for human rights in the context of access to HIV prevention and treatment. For 3 years, partners of SOS project reduced legal barriers, eliminated legal barriers on the path of access to medical services, eradicate stigma and discrimination about people living with HIV and representatives of key populations. And joint efforts were focused on decriminalization of HIV transmission, sex work, drug use, or same-sex relationships. And the human rights activities were implemented at various levels, local, national, and international. And also in various areas, from mitigation of self-stigma among clients to submission of shadow reports to UN agencies. The activities were focused on a variety of key populations and were implemented in various regions of EECA. And definitely this was huge endeavor of partners, counterparts, and definitely they deserve your applause. But we would like to organize this panel discussion in a little bit different way to avoid abstract generalizations or statistics, and in the course of this session we will speak about how partners worked, proceeding from from the individual towards the system. We will try to illustrate these human rights activities based on a concrete case study. Based on that story, we will follow the whole track, the whole path from the problem, detecting the problem, to addressing it, and we will hear important recommendations for efficient human rights work based on that case. So we will see how to influence the legal environment in a systemic and comprehensive way to mitigate, to eliminate legal barriers on the path of access to vital health services. And now I pass the floor to the first participant of the discussion. This is Nikolai. Please support Nikolai. That's better. Hello. Hello. So let's. Could you please introduce yourself? I'm Nikolai Bort. I live in Argeia, in Moldova. I am a substitution therapy client with ibuprofen in Chisinau, which makes it possible for me to work, to provide for my family, and live in a virtually comfortable life. Virtually, almost. Why almost? Well, imagine that the city of Argeev, it is 50 kilometers away from Chisinau. So this makes it the trip 100 kilometers when you go there and back, so it is 3 or 4 hours each day on the daily basis. Yes, 3 to 4 hours daily to come and get the treatment. And as far as I understand, for many years they promised that there will be a site in your city, but it didn't happen. Yes, it never happened, even though we have women with young children, 2 patients who cannot, we have 2 patients with limited mobility. Maybe there were few of such people, and that is why they didn't launch a center. No, it's not a small number, 40 people, I believe. Oh, that's 40 people, that's enough. And I didn't really So we did a lot of work. We went to the mayor, to the mayor's office. We met the officials, explained what the issue was, and they said, we're going to help you, but nothing happened. Okay, but have you tried to undertake some key steps that could significantly change, transform the situation? Well, yes, that happened for some 3 years. And at a certain point, I lost any hope. But still, I decided not to give up. And I discovered that in Chisinau, and there is a paralegal, para-lawyer, and I decided to go to him and explain this issue. I know this guy, and he is with us here in this audience. Well, exactly. I wanted to invite him. Alexander is with us here in the audience, and let's welcome him.
So that we can look at the situation from different perspectives, we will also talk to Alexander. Say good afternoon, Alexander. Could you introduce yourself? My name is Alexander, and for 9 years I work as a peer consultant in Initiativa Pozitiva NGO. In the past, I also had an experience of drug use, and in 2010, I became the client of substitution treatment. So I know how important it is to have support of people who understand you and to have favorable conditions, not to have a relapse. And in addition to outreach services, I also provide primary legal support. In 2020, I was invited to become an agent of a REACT program on human rights violations and response to such violations. Thank you. Could you tell us about the case of Orhei, where our main character comes from? So how did you learn about this issue, and what did you do? So when I was in Orhei, a group of people contacted me, including Nikolai. So the problem was about lack of access to OST in the city and all the inconveniences because of this lack of access. So I saw some aspects of human rights violations there, and it kind of feels like it is just a medical problem. But if we look more closely, we will see that the right to health is violated. So I submitted this case to the application on my telephone in Orhei so that this case can be addressed. So you said that you saw some aspects of human rights violations, but you're not a lawyer. So how can you understand what cases about human rights violations and what is not? Yes, I'm not a lawyer. I'm a paralegal, and I was specially trained, and I have some basic knowledge of human rights violations, of stigma and discrimination. So I can understand what rights were violated and what are the characteristics of such violations. At the same time, I understand that sometimes my competence is not enough. So through REACT, I can ask for support of professional lawyers. Okay, so if instead of you, there was a professional lawyer, would it maybe change the situation in this case? You know, the level of trust to me is probably higher than to people who have no relations to a drug users community. So I doubt that a drug user would fully trust a person not from this community. So probably we wouldn't even know about the problems faced by our community without peer consultants. But I understand that professional lawyers are also very important because they can help us to address our cases in courts. And there were cases when they went to the European Court of Human Rights and won those cases. Could you share your story? How did you become a paralegal? I became a paralegal after special trainings and educational materials that I read. So there are a lot of materials actually that you can get acquainted with. For example, 100% Life NGO, they published good materials for paralegals. And also there is the Eurasian Women's Network on AIDS, and they initiated a hub for paralegal support to people whose rights were violated. So we really hope that this hub will continue its work, and so far you can get acquainted with the materials that they prepared. Alexander, and how do your clients respond when you offer them legal support? You know, it is important not only to train paralegals, but also to train members of community, because they do not always know that their rights were violated. They do not always understand that certain actions of law enforcers are unacceptable. So our mission is to train members of community so that they can understand that their rights are violated, so that they can defend their rights on their own or with our support. Yeah, it's really hard to argue with this message. And Alexander, thank you and all your colleagues, paralegals, for the very valuable work that you do every day and support to such people as our hero. So now I would like to ask what happened in the case of Orhei after documenting human rights violations. So now I invite our next guest, Ruslan Paverka, Director General of Positive Initiative NGO, coordinating implementation of the regional project in Moldova. Good afternoon, Ruslan. Good afternoon. So could you please tell us what happened with the case about OST site in Orhei? Well, it's important to say that this whole situation did not just happen now, but it has been going on for quite a while. But sometimes there were situations when some patients complained, and we raised those issues at some working groups, but the situation did not change. And in 2020, we launched the REACT system mentioned by Alexander, and it allowed us in a short time to collect evidence based on human rights violations. So the cases, there were quite many cases of human rights violations from Orhei, and this evidence-based allowed us to show the scale of this problem to decision makers. And at the same time, we saw that patients are willing and are ready to defend their right to health. Really, today, we named one of the tools for systematic monitoring of human rights violations several times, so I want to show you a little video about the REACT system. Since 2019, in the EECA countries, we have a REACT system to document and respond to the legal barriers and violations of human rights for key populations. Key populations often face stigma and discrimination. In such cases, they can ask a reactor for help. A client tells the reactor about the case of human rights violations, and REACT can offer counsel on legal issues, can help to prepare legal documents, and help to file complaints at law enforcement agencies and in courts, and provides legal aid, and also a client can be referred to professional legal services and other services. The reactor submits the information to the database, and the case is available through the database only to the users with relevant access. And the reactors, there is a coordinator who monitors cases and the response, and also plans the advocacy work to prevent similar cases in the future. And the collected data is used when holding negotiations with government institutions to reduce stigma and discrimination, to advocate for changing policies and practices, and to have an impact at the international level. On the information portal, you can find statistics, reports, successful cases, and recommendations by lawyers and psychologists. Thank you, and let us come back to the specific case of Orhe. So my question to you, Ruslan, so what actions did your NGO take after that? It was important for us to have a meeting with the Ministry of Health because before the minister signed an order according to which a certain number of sites, OST sites, was supposed to open, including in Orhe. But the situation didn't change, and we wanted to understand what is the reason. So did you understand the reason? Yeah, it was clear that the management of the clinic in Orhe did not want an OST site to open in their premises. So in our specific case, not so much people living there, but health workers were against opening the OST site. Yes, it is our sad reality, because in the region we had a lot of cases where, like, the neighbors complained about OST sites located there. But okay, maybe they didn't have enough information, maybe they don't know anything about the drug use, drug dependence, and its treatment, and well, that can be understood. But when health workers, discriminate people, that is beyond any limits. Can we actually somehow respond to it? We should respond to it, but we need to understand that those things are deeply rooted and certain things that people are used to. So we need to prepare ourselves for a long-term process where we need to work with the personnel of health institutions and raise their awareness. But it is also important to work with administration of health facilities so that the internal policies are aimed at monitoring and responding to such situations. And what else did you do in this particular case of Orhe? Well, we realized that this whole story will be going on for some time, and we realized that we will start a conflict and confrontation with decision makers. So at such point, we usually create a certain media environment which can be favorable and to build the public opinion on specific cases. So we made a lot of efforts, and we worked on this topic for about a month, and then we moved forward. It's interesting. So working with mass media and with administration of health facilities, that is very important. But does it help to resolve the problem? Maybe you could file a complaint with a court, for example. Yes, of course. So when we do some advocacy, there is some end point where we are ready to go va-bank and to file a complaint with the court. But we did not go to court in this case. In our country, we have Equality Council. So this is an agency approved by the parliament, and the parliament delegates people who work there. So it has quite a lot of powers and authority, and this Equality Council reviews all the cases of human rights violations, and if this council thinks that the rights were violated, they make decisions which the perpetrator has to implement. We have many years of experience of working with Human Rights Council, with this Equality Council, and in this case also we submitted a complaint to this Equality Council, and we made a video addressing decision makers. So do I understand correctly that your organization was actually in confrontation with a health facility and went through all this path? Yeah, well, we are awesome, but still we prefer to work with our partners, and actually when there are some challenging problems requiring advocacy efforts, we need to mobilize all the capacity and all the other stakeholders, and that is what we did. All HIV service organizations supported us, and it was quite easy for us because the team coordinating the national program also supported this idea of scaling up access to OST, and the chief drug treatment officer of Moldova was also with us. Thank you so much, Ruslan, for such a detailed description of the actions taken at the national level to respond to the situation in Arhei. It was an interesting case, an interesting experience, and thank you all, dear guests, for sharing with us openly about what was going on. But I wanted to say that our list of recommendations for effective human rights activities is not full yet. So our next guest is Svetlana Moroz. So Svetlana, for 15 years, works in human rights and HIV in the Ukraine and also at the regional level. So she lives for HIV over 23 years. She is a co-author of guidelines for paralegals in the context of HIV decriminalization and research studies with the leadership of women's community, and also shadow reports to the UN agencies. Good afternoon, Svetlana. Good afternoon. Svetlana, you are the leader of the Eurasian Women's Network on AIDS, and today at the session we using this case about people using drugs, we try to make a list of recommendations for effective protection of human rights. As I know, you did not work with this particular case, but you still have a big experience of human rights protection, right? Yes, the Eurasian Women's Rights Network, like together with my colleagues from Eastern Europe and Central Asia, we work with the decriminalization and women's rights, and we work on issues of gender-based violence. But we understand that decriminalization of HIV can not be viewed just separately. It is related to criminalization of drug use, sex work, and the LGBT community. And we understand that women from the community of sex workers and people who use drugs, like women in prisons, bisexual women and transgender women are all vulnerable, especially in the context of COVID pandemic. So those women face multiple stigma and discrimination. Often they do not have a voice and resources to protect their rights. So we promote gender-sensitive and gender transformative approaches. Of course, women should not remain without vital support, and it is important to take it into account when planning the work. But could you give a couple of advice for our audience how they should interact with communities when we talk about human rights protection and advocacy? Well, first of all, it is important to look at communities not as a problem, but as part of solution. And my experience shows that people from the communities, they are most motivated and most interested in legislative changes, and they know best how discriminatory legislation influences their life and health and access to justice and their ability to unite in networks and form NGOs. So I think that for successful human rights activities, it is very important to involve and engage people from the key populations. So that is the principle, nothing about us without us. Right, that is the principle I'm talking about. Right, and I think that that is a big, really victory of our also colleagues from Belarus. Right, we have a good example in case when People Plus NGO in Belarus were able to promote changes in a criminal code, Article 157, about criminal prosecution of people living with HIV. So they became like an advocacy bureau, which did not just help people who could suffer or suffered from human rights violations, but also they had a strong advocacy campaign and effectively worked with legislators and law enforcers and civil servants. That is really a very big achievement. Let us congratulate our colleagues. We are so happy for them. But going back to the Orhei case, so in this case, legislation was actually supporting the clients because OST is available in Moldova, and there was a decree on establishing the site. But the question why, in practice, the OST site wasn't launched for quite a long time. Why was it not operating? And generally speaking, why in some situations when there is even a good law, sometimes it doesn't work?
It is not enough to adopt a good law. You also need to create the environment in which it will function, and you need the leaders who will promote, advocate for the change, and implement that. And the example of Belarus and Moldova is a good case study. It proves that community activists can be the leaders there. They have developed the partnership. They have created this context which made it possible to achieve the final output for the benefit of those people that they worked for. So it is important to bring together all the civil society, mass media, UN agencies, and of course the government. You cannot do without that. Thank you for your response. So what should be done if the law is right, good, but not enforced? Well, we've discussed that. And now, which steps need to be undertaken, and what should we pay attention to if a discriminating law, very wrong law, is implemented? Maybe there are examples of HIV criminalization. I don't have one response for all countries that have very different situations, conditions, and contexts. So it is important to take the context into account. And the good example there could be the situation regarding advocacy to withdraw the discriminatory provision on prohibition of adoption for people living with HIV. And last year there was a boom, the very active wave in this sense, and 4 countries revised their laws. In Ukraine, activists invested a lot of effort, and the Minister of Health was on our side, but we could not change that prohibition. And what changed the situation? That was just a brave step by an activist, HIV-positive activist, who sued the Ministry of Health. In Moldova, they managed without suing anyone. They advocated for, by the positive initiative did that. In Russian Federation, there was the resolution, the decision of the Constitutional Court. Eventually, in 2020, there was the resolution of the government. In Kyrgyzstan, that's also a good example. the great work of a friendly advocate who achieved the result that this prohibition of adoption was deemed unconstitutional, discriminating at the level of the Constitutional Court. These are different countries and different advocacy-related situation. And then, if there are so many aspects and obstacles on the path of change, what price do activists pay for achievements in advocacy? Well, that's a good question, because I always think about advocacy of our activists. And here it is important to remember the do no harm principle. No achievements are worth destroyed lives. So when we submit shadow reports, if it is about the Russian Federation, for example, we do not indicate the activists or the organizations that will work in the country because they are under threat or they already have that status of a foreign agent. And while our activists from Central Asia, they participate in briefings with civil society, UN committee sessions, they come for those sessions where there are no representatives of their government, so that they could not be identified by the officials. And I know a case which it would be important to mention for you to understand how severe the threats are and the situation of our activists. After submission of the alternative report, an activist from Central Asia was contacted by officials. They said, "You are disgracing the country. We are going to complain to the prosecutor's office against you." So this is quite a hazardous environment, and our activism may result in quite heavy, serious consequences. Thank you. Another question: if all advocacy initiatives are success? Unfortunately not, and we know about the cases where the situation would result in even more dramatic provision of the law, because the opponents get mobilized and they cause resistance. So you need to be wise and tolerant enough to anticipate these risks. Thank you so much. Are there any mechanisms, for example, influencing the country from outside? If international community can influence a certain country so that the country adopted or withdrew certain laws? Yes, of course. There are international response mechanisms, and EECA countries, almost all of them, have entered into the key conventions, and they report on their implementation, and that's a chance for the communities to ensure accountability of the governments for those commitments. And within SOS project, we submitted 2 alternative reports on Kyrgyzstan and Russia, and those reports were focused on decriminalization of HIV. And speaking about Kyrgyzstan, there we received incredible recommendations, great. Among other things, that's decriminalization of HIV infection, withdrawing Article 149, and the committee also recommends decriminalizing having drugs not for the purpose of trafficking, and also to criminalize attacks on activists, human rights activists, and also the transgender and LGBT communities. And I can congratulate colleagues from Kyrgyzstan really to inspire you to continue working to eliminate all forms of discrimination against women at the country level. Thank you so much, and let us support your wishes for human rights activists, women, female activists in Kyrgyzstan. Thank you for being with us. Thank you for this opportunity. Making use of this opportunity, I cannot but mention the fate of someone who is very dear to me. This is Natasha Zelenina. She's my colleague. She's a social worker of Svetana Club. She worked in harm reduction. Now she has been in jail for more than 4 years, starting from 2017. In 2019, the court sentenced her to 11 years in prison for drug trafficking. Andrei mentioned the impact of the war on clients on substitution therapy. He mentioned the Crimea, but that also affected those who live in Lugansk and Donetsk oblasts. And Natasha is a victim of the repressive drug policy. Sorry, I'm... So I appeal to everyone who could help her, because we've done everything possible for her to be on the list of people for this hostage exchange list. There was communication in European Human Rights Court for Human Rights, but for 4 years now she's been there, and it is so painful to realize that she is waiting for someone to help her. And I really hope that due to our joint efforts, we will be able to free her. Thank you so much, Svetlana, and we do hope that this message will be heard. And you know, over the 40 years of this session, we've managed to travel from Argeyev in Moldova to shadow reports to UN contractual bodies. And I believe that on this path, we've managed to draft the list of valuable recommendations and advice for human rights activists in the EECA region. And an attentive viewer would say that this goes in line with 7 key practical programs of UNAIDS to mitigate stigma and discrimination and enhance access to justice in national response to HIV/AIDS. And you know, that's true. During this session, we've managed to demonstrate practical implementation of these programs via experience and day-to-day work of our colleagues and partners. And thank you so much again. And eventually, the final conclusion of this discussion today is going to be the following thesis. Human rights activism in EECA region must be comprehensive, multivectoral, and of course, the ongoing sustainable. And of course, it needs to be based on leadership of communities and dialogue with the state, because what we discussed today, it is really about dialogue and about teamwork, because only with proper instruments and activities, interventions, it is possible to achieve the results, and most importantly, to achieve changes, transformations in our countries. Let's once again support our participants. And before I let you go, dear speakers, I would like to go back to Nikolai. So what was the end of that story? How did the case end? Well, dear Nika, starting on the 25th of October this year, the site in Argeyev was launched, and instead of like 3 or 4 hours, it takes me just 10 to 15 minutes. Time is the most valuable thing that we have, actually. So I'd like to express gratitude to people, to everyone who has been doing this, who's been following this cause, and we are sincerely grateful. Thank you. We are so happy for you. I'm grateful to everyone who has invested effort, and thank you again, dear speakers. And most importantly, thank you for your honesty, for your integrity, and for your day-to-day work. And with this warm applause, I say goodbye to you. Thank you again. While us, dear friends, we proceed. And the next, I wanted to say panel discussion, but actually the next session is going to be held in combined format, and we have prepared it on our screen. So let's watch. I am Maira. I live in Dushanbe. Hello, it's me, Nika Konstantinova, and these are news of the first regional program on COVID-19. How SOS project team implemented the program in ECA region since November 2020 till June 2021, where $1 million was invested, how much antigen tests have been distributed, telemedicine, procurement of the consumables. These first results and outputs of the first program to counteract COVID. More information in our news. The global pandemic of COVID-19 in 2020 caused the global crisis, and it significantly transformed the world. On the 30th of January 2020, WHO announced the situation of emergency, state of emergency, and in March we found out that this is the new and deadly pandemic. Currently, globally, more than 260 million cases of COVID-19 have been registered and more than 5 million deaths. In spring 2020, EECA were affected, countries were affected by the first wave of COVID, and healthcare systems were not ready for the new challenge and they needed support. It was necessary to respond quickly. In that situation, well-developed civil society and NGOs that over the 3 decades of counteracting HIV and AIDS have achieved significant progress, applied all of their experience and skills. There was significant influence on sustainability of HIV services and uninterrupted access to treatment. Alliance for Public Health, UNAIDS, and Central Asian Association of People Living with HIV have collected the stories of response stories on the interactive map and have rolled out the experience of the region. But of course, that was not sufficient. Since November 2020, the first regional program was launched to counteract COVID-19 in the framework of C19RM mechanism of the Global Fund in order to support new and existing prevention programs in countries of the region. As humanitarian aid, 8 countries of EECA region received 80,000 express tests that can detect COVID in 15 minutes. They were used in public healthcare facilities and NGOs for express testing of people living with HIV, people with TB, and people from other key populations and their contact persons. One of the most challenging tasks was to supply the tests in the situation of the lockdown, but nevertheless the tests were even delivered to those people in distress who live in distress. And let's find out how that was possible from the president of Central Asian Association of People Living with HIV. It was very important to obtain this timely assistance, COVID express tests. I should mention that the express tests were distributed to health facilities, NGOs for testing of people living with HIV and representatives of key populations. All the positive results, happily there were not that many of them, but all of them were confirmed by the PCR method, and due to this we have the opportunity to timely detect and refer those people for treatment. Only with joint efforts will we be able to influence a reduced rate of spread of the pandemic. One of the first countries using rapid tests was Moldova, and that was very justified. Over the first months, out of 123 express tests, 11.6% turned out positive, which is very high. Director General of the NGO Positive Initiatives, Ruslan Verga, commented on this situation. The situation caused by COVID was a challenge for us. This is about minimization of risks of infectioning of both the employees and the customers. So providing for access to prevention services in these conditions is quite a challenge. And thus availability of express tests was key and made it possible for us to protect our team and clients. And thus we continue to provide these services. From Moldova to Ukraine, according to statistics, Ukraine is one of leaders in the number of detected COVID cases. So thus we're supplied to COVID to test vulnerable populations for COVID. And this is comment from Executive Director of Convictus Charitable Foundation, Evgenia Kushinova. Many of our clients do not have a declaration signed with family doctors. Some do not have documents, and thus they are not involved in the healthcare system. We try to work with these barriers. We try to help the clients to have access to the required health care and social care. And we implement COVID-19 testing, which makes it possible for us to be more cautious, ensuring safety of our social workers. We suggest implementing this mechanism for self-testing. We managed to talk to Nikolai, who came to Convictus for help. I received services from Convictus. I've been doing that for several years. Before the lockdown, I could feel that it is so difficult to address health issues. I had no money to do COVID test in a private laboratory, and I don't have a declaration with a family doctor. I didn't know what to do and how to be treated, and I'm grateful to Convictus for this opportunity for testing and explanation on how to sign the declaration with the family doctor. I understand that above all, that is necessary in order to further have free access to medical services.
So as Aybar Sultangaziev, head of Kyrgyz Partnership Network Association, said, using rapid tests for COVID-19 helps to detect the virus quickly, and detecting COVID-19 in 15 to 20 minutes allows to start treatment quickly, to keep isolated from other people, and to stop transmission of the virus. So the clinics in 3 cities of Bosnia and Herzegovina received the rapid test for COVID-19, and Aida Kurtovic from Partnership in Health pointed out that as the situation with COVID-19 in Bosnia and Herzegovina and in the whole region is very difficult, and the tests supported by the project were received in proper time to support the country and response to pandemic. And the partnership in health in Bosnia and Herzegovina says thank you for the support in this challenging time. Montenegro was also received support, and Tsazas NGO provided 5,000 to the Podgorets health center, and the Sadatišović from the Tsazas commented that it is one more mechanism to work with the primary health center in Podgorica. It is good to say that today we have an opportunity to exchange the knowledge about response to the needs of key populations, said Sanya Shishevich, program director of SAZAS, and she said that it will help to overcome the pandemic. And Danila Jokic, director of medical center in Podgorica, said that they have good cooperation with the SAZAS NGO, and the support provided by SAZAS is very important, especially for people in Podgorica. And our next topic is support of women who inject drugs, and the armed conflicts, economic crisis, and pandemic of COVID-19 increase the probability of gender-based violence. It reduces the quality of life for women who use drugs. And in 2020, the Eurasian Harm Reduction Association and their a project Access to Support for Women Who Use Drugs aimed to help such people. And during such project, help not possible to ignore guidelines were developed. And this publication defines three important components, such as stigma in the society, from family and social services, difficulties in access to support and care, and problems in access to services. And all the activities to respond to gender-based violence, they can be grouped in three groups. So the first one is prevention of gender-based violence, second, support of women who use drugs in situations of gender-based violence, and third, advocacy of legislative changes. So this publication contains a detailed instruction on how to make sure that the services correspond to the needs of women who use drugs. So Executive Director of the Eurasian Harm Reduction Association, Anna Dolbach, told us about the project. In the challenging time of COVID and lockdown, women were locked in their homes with their partners or husbands who were abusing them. And if they use drugs, they do not have access even to shelters for the victims of gender-based violence. And for us, it was important to put this linkage with between the services for victims of gender-based violence and women who use drugs. And in 5 countries of the region, we started to put those connections between harm reduction services and shelters as safe spaces for women in crisis circumstances. So we prepared guidelines which depicts this message: help, not possible to ignore. And it is very important for all the services and departments which provide or can provide support to women in difficult life circumstances unite their efforts to support to a specific woman and her children. Meaningful contribution in the program was made by partner organizations in Kazakhstan, Revanche in Macedonia, Hopes in Serbia, Regeneration in Russia, Andrei Rilka Foundation, and in Ukraine, Convictus Ukraine. So the activities of partner organizations included advocacy activities and provision of services, focus groups with women who use drugs, workshops and webinars and supervisions and roundtables with service providers. Also, amendments were made in the regulations on access to services such as shelters. We would like to mention that cooperation between the government agencies and the NGOs creates all the conditions to provide complete and good quality help. And now let us talk about statistics. 16 cases were documented when women who use drugs faced violence and human rights violations or obstacles when receiving services. 25 women who use drugs received legal and or psychiatric services and or shelter within 5 small grants. 700 of professionals and experts in EECA countries received recommendations on making amendments in the systems to provide access to of women who use drugs to relevant services. And now we start our next topic, uninterrupted provision of HIV services in the cities. So we will talk about the countries which did not receive support of Global Fund, Russian Federation and Bosnia and Herzegovina. But within the first COVID-19 program, they could receive support. In Russia, new approaches were used in harm reduction programs such as in Petersburg and Chelyabinsk received the condoms, counseling online, and syringes. For example, 8 vending machines to provide condoms and 3 vending machines for syringes were installed with 30,000 condoms delivered and 75,000 syringes distributed in NGO premises and in health facilities. And that is how the work was coordinated by a coordinator of C19 RM, Nadia Yangal from Alliance for Public Health. For us, in the situation of crisis, the first task was to help people. These people, because of their health situation and lifestyle, have to often seek help in medical and social centers to receive relevant services. And they say that crisis is also a time of opportunities, and I think that that is our case, because modern vending machines were procured and delivered to service centers in 2 cities of the Russian Federation, and thus we were able to ensure uninterrupted provision of services related to HIV. And now let us talk about Bosnia and Herzegovina. Rapid transmission of coronavirus was a big challenge for the health system. In the start of the pandemic, the country faced a number of problems. Insufficient readiness to crisis situations and low decision-making and challenges in data collection. That is why government couldn't take the necessary measures rapidly. So the small cities faced additional problem of lack of access to infectious disease doctors, and the SOS regional partner worked with Sarajevo and Vilna and other cities within the Fast Track initiative, and the result of such cooperation was developing interventions, procurement of tests and protection means, and also creating a telemedicine platform. The platform is aimed for health workers working with COVID-19. They can access help of health professionals on how to manage patients, track contacts, and other questions can be responded. I will cite Aida Kurtovic, organizer of this platform. The telemedicine platform, developed within the first regional program, was a unique activity to support the response to pandemic, and was a solution to limited access to health professionals in the country. The platform allowed to bridge the gap between bigger cities and smaller towns, and allowed health professionals to provide consultations in a safe environment. And now we move to our next topic, planning, response to emergencies and sustainability of HIV services during the COVID-19 pandemic and other emergency situations. So the impact of COVID-19 on the region of Eastern Europe and Central Asia is so strong, but at the same time having HIV epidemics in key populations. And there is one similar characteristic of all the countries, the need of effective response to COVID-19, not to disrupt the progress in responding to HIV. And within the first regional program, guidelines were developed on how to plan activities for emergencies to ensure sustainability of HIV services for key populations during COVID-19 and other emergencies, based on which amendments will be made in the national strategies and action plans to provide economically efficient services in situations similar to COVID-19 crisis. And in addition to uninterrupted provision of services, adaptations suggested in this guidelines can have certain advantages. Lower threshold services provide more client-oriented approach and increasing the sustainability through bringing down operation costs and also building sustainable bridges between government and non-governmental actors. And that is what coordinator of C19RM, Nadezhda Yangal, says about it. We did right and timely approaches developing these guidelines for stakeholders, and its main goal is to help the countries to plan for effective response for emergencies, to adapt to the new realities, and to ensure uninterrupted provision of HIV services in crisis situations. Planning in case of emergencies can become an important factor of changes thanks to the thorough algorithm of activities and adherence to sustainability of HIV services in the times of pandemic. We hope that this publication will help the stakeholders to use the opportunity to create more accessible, fair, and sustainable services for people who need it most of all. So Our program is over. This is Nina Konstantinova. I wish you good health and to you and your close ones. So, dear friends, that is the news that we had for you today. And you know, right now we are approaching the finish of our event, and today we ask questions to our speakers. So you asked them and our online speakers asked the questions. But now I want to ask you, did you like it? Was it helpful? We sincerely hope that we will receive feedback not only today in the course of our forum, not afterwards when we draw the conclusions of the forum, but also in the future, because that is why we did it, to build this dialogue. So, our forum is now close to its finish, and to be honest, we did a huge work, not just today actually, because we were drawing the conclusion of a 3-year project which really transformed the situation around HIV, AIDS, and the COVID challenges, and many things which seemed unrealistic when we started this journey now exceeded our expectations, and many aspects are now became a norm thanks to the work of the regional leaders and partners of the SOS project. And with a round of applause from you, I would like to invite on stage Executive Director of Alliance for Public Health, Andrei Klepikov. Thank you. So, the forum was a success. It could not have happened, and I would like to first of all say thank you to all those people who made efforts throughout those 3 years, so that today we have things to exchange, our knowledge, experience, developments and plans for the future. I would like to say thank you first of all to my team, Alliance team. You did a huge work. Thank you. I would like to say thank you to the members of Consortium, the Network 100% Life, Central Asian Association of People Living with HIV, Eurasian Coalition of Key Populations, and I would like to thank all our partners in the country, everybody who joined this project and contributed to it. So one project is coming to its end, but I remember how we started. We started with setting the goals, and we now raised the standard as high as possible. We were told that it's not possible. 73 million of savings is not possible, and with our joint efforts, we got 119 millions of savings, and that is for all the indicators. We not just performed our goals, but we overachieved them. And thinking about the next 3 years, about the goals for the next 3 years. On the one hand, they are defined with the global targets, 95, 95, 95. But if we make those numbers human, let us look at people and listen to what goals are seen from us, are set for us by our clients, mayors of the cities, and people from government institutions and non-governmental organizations. So we asked our partners in the countries to make videos with people's expectations to set the standard for us for the next 3 years. So let us have a look at the screen. I'm Mahira. I work in REACT Tajikistan program. I would like the situation with the human rights of people living with HIV in 3 years to change for the better, so that people living with HIV can seek health care, so that there is no stigma in society, so that there is no such thing as criminal prosecution because of HIV status. I believe that in 3 years, the attitude to the key populations will change thanks to the opportunity to document human rights violations. Как я вижу города, подписавшие Парижскую декларацию в следующие 3 года? Я вижу, что они идут по пути.
Koji je otvorio kuću zdravlja. Ja očekujem naredne 3 godine da će gradovi koji su potpisali Parijsku deklaraciju otvoriti kuću zdravlja i pružiti usluge osobama koje žive sa HIV-om, intravenskim korisnicima droga.
Я работаю с 3 ключевыми группами.
So I work with the 3 key populations, and in 3 years I would like our efforts in advocating for human rights to bring results. We hope that the government will pay attention to this problem, and people living with HIV should not be afraid of their status and should not be afraid of stigma and discrimination from the side of society. Sex workers should not be afraid of law enforcers and should not be bribed by them, and people who use drugs should not be able to work on the street with no fears.
Через свій діагноз.
Я хочу, чтобы в Украине через 3 года соблюдались права.
I hope that in Ukraine, in 3 years, human rights will be respected, healthcare will be affordable and not corrupted.
Doris საქართველოსთან. რეაქტის დანერგვაში ჩართული ვარ პირველივე დღიდან. მიხარია, რომ მომეცა შესაძლებლობა შემეცვალა ჩემი ბენეფიციარების ცხოვრება უკეთესობისაკენ. აღნიშნა, რომ ჩემი кейსების უმეტესობა შეეხებოდა აი დადებითი ადამიანების შრომის უფლებების დარღვევას, რაც ქვეყანაში არსებული მწვავე მდგომარეობის გამოა გამოწვეული. 3 წელიწადში მინდა, რომ აი დადებითი ადამიანები აღიქმებოდნენ სრულუფლებიან და სრულფასოვან ადამიანებად, რომ აი სტატუსის გამო არ იდევნებოდნენ. ყველამ გაითავისოს, რომ შიცი, ჩახუტებით და მეგობრობით არ გადადის, რომ ისინი ჩვენი საზოგადოების წევრები არიან და შეიძლება ხვალ ჩვენც აღმოვჩნდეთ მათ ადგილას.
За 3 години од сега Скопје го гледам како град кој што е почист, позелен и место во кој што луѓето што живеат со ХИВ и засегнатите заедници од вирусот се чувствуваат заштитени и слободни од дискриминација. Град во кој што имаат пристап до широк спектар на услуги за заштита на своето здравје и за социјална поддршка на ниво на заедница. Град кој што возможува и поддржува активности за заедницата во унапредување на јавното здравје. Од голема важност би било и поголемо вклучување на младите во програмите за заштита за превенција на ХИВ, крвно и сексуално преносливи болести и намалување на штетите предизвикани од употреба на дрога.
Я хочу, чтобы программа заместительной терапии.
I want the substitution therapy in Kazakhstan to be sustainable. I want this program to scale up and cover all regions of Kazakhstan so that all people who need OST services could access them.
Та медиків у випадку домашнього насильства.
Я бы хотел, чтобы через 3 года в нашем регионе был реально равный всем.
I would like it that in 3 years in our region we have a really universal access to the best possible medicines to treat HIV, in particular, so that every person with HIV, irrespective of the place where they live, the population they belong to, could receive the best possible access. I don't really like unequal conditions that are created for our countries. I don't like the price of the Lutagrapir is 100% per pack in one country and 3.5 in another country. I would like the governments of our countries to use all the opportunities to provide the best possible options of HIV treatment for their citizens. These opportunities could include compulsory licenses, parallel imports, exhaustion of rights, and so on, so that civil society would be actively engaged in this process as continuing its work for the benefit of all people living with HIV in the region. I hope that in 3 years in Ukraine, diagnostics and treatment accessible for people living with HIV and no discrimination.
Point, a koji nudi građanima besplatno testiranje i savjetovanje na HIV i AIDS, kao i osnovne informacije o prevenciji HIV-a, AIDS-a i ostalih spolno prenosivih bolesti, a koji je nastao u sklopu jake saradnje između grada, javnih institucija i partnerstva za zdravlje kao krovne organizacije koja se bavi ovom temom u Bosni i Hercegovini.
Za 3 godine mi vrijedimo Niš kao grad koji će imati bar 60% manje obolelih od svih zaraznih bolesti, seksualno transmisivnih bolesti i među tim bolestima i side. To je naš cilj.
Я бы хотел, чтобы брали 113.
I would like Article 113 to be abolished so that people living with HIV could come and get tested with no barriers preventing them from testing.
З'являлись каб програми профілактики і підтримки людей з ВІЛ базіравалися на потребностях супольності. Каб яны фінансаваліся дзяржавай у тым аб'ёме, які патрэбна, каб спыніць распаўсюджанне ВІЛ-інфекцыі.
In 3 years, we would like to have protocols for self-testing and people trained in that, as well as for other remote services, as well as rapid start of ART for people diagnosed with HIV without waiting for the results of viral load or CD4 test. Well, in 3 years, for example, I come to a dentist, tell him about my status, and saw that he didn't jump aside from me and asking another doctor if he can help me, so that they treated me normally as a person who comes to him seeking for help as any other person.
Kroz akcioni plan i budžet opština biti dovoljno sredstava kako bi nevladine organizacije koje se bave ovim problemom mogle pružiti usluge korisnicima kroz naše drop-in centrove i naravno kroz kuću zdravlja. Ono što ja očekujem za Crnu Goru jeste da ne samo ova 3 grada koji su potpisali Parisku deklaraciju, Podgorica, Bar i Bilo Polje, već i ostali gradovi se pridruže i sljedeće godine uspijemo bar još 5 gradova u Crnoj Gori da potpišu Parisku deklaraciju.
Recently, my Georgian colleague contacted me about a man she knows who lives in St. Petersburg. He was hospitalized for an emergency care with numb limbs and fever. He's now in intensive care. 4 years ago, he was diagnosed with HIV, but he had no opportunity to access treatment. He is in Russia illegally, and foreigners with HIV must leave Russia. They have no right to stay. I want such situations to never happen in EECA region. As an open representative of LGBT community, I would like to walk along the streets with my partner, not being afraid that homophobes can attack me, not just walk, but even hold hands. In 3 years, I see a totally different situation regarding rights of people living with HIV. They do not face discrimination in health facilities. All people are equal in front of diseases. They do not face discrimination when they want to adopt children, as HIV status doesn't prevent one from being a loving parent. They are not discriminated when they want to get a job. HIV status never prevented anyone from being a professional. My belief that it will happen this way is not about hoping for a better tomorrow or good luck. It is about firm confidence in the result of work of my colleagues and allies. Changes have already started. Dear friends, well, you know, the only thing I can add here is that it is with these events, as we have had today, as every day during the years that the work has been done, and based on just examples of real people, that with all of that we implement massive change, not only in one particular city, country, or even region. I do believe that we are creating history of humankind. So all of us here, I want you to realize how important you are. Thank you so much, and this applause goes to you, that you've been with us from the very beginning on the day-to-day basis. And now the forum is going to be wrapped up. So Health Sustainability Forum HIV and COVID-19 in EECA countries is over now. We are grateful to all organizers, partners, all participants, to everyone who has participated in this forum. And I am Nika Konstantinova, and thank you so much, and see you soon again. Stay healthy.